Thank you, everyone, everybody in person and virtually. We do have the hybrid environment here. So the screen and the microphone are down here at the end of the room. The speakers in the middle here should pick up regular sounds. If we hear any feedback online, I'll be sure to let our speakers know to increase their volume a little bit. Otherwise, the presentation is being shared virtually as well. And we can tag in the white lights should be good.
The last one by Kim and Michelle is not white.
Okay, I have a can replace that plan. Thank you. For any of our virtual partners,
That's because it's not plugged in.
the raised hand feature if you want to interject into the conversation at hand. Otherwise, we have chat functionality and one of the handle your chat to the presenters. Does anybody online have any questions and are we coming through good? All right, if you are having any difficulties, please use the chat and just let me know and we'll troubleshoot it together. Josh, I think we're good.
All right, turning over to Kim and Michelle.
Josh, we want to do intros first and then I'll start
Sure.
with some opening comments.
Want to kick us off?
We end with me. We start where Sarah was and come this way if that works.
So
We'll get this side and then we'll go this side. If that
Okay.
works.
Kim Alvey, Teller County DHS Director.
Amy Sherman, Chief Operating Officer, Denver County. Mary Burke, Jefferson County. Heather Durofsco, CHSDA.
Megan Birch, Eagle County and CHSD President.
I'm Shelley Banker. I'm the Director of the Office of Economic Security at CDHS. My pronouns are she, her. Spencer Green with HCPF, PCA.
Tiffany?
Tiffany Bryant, CBMS Product Director.
Muskana Tesfaye, CDHS, Business Innovation Technology and Security Director.
Morning, Samantha O'Neill Dunbar, the Budget and Legislative Manager for the Office of Economic Security at CDHS.
Abby McClelland at CDHS, the Division Director for the Food and Energy Food and Energy Assistance Division. Thank you.
Ian McMahon, CDHS Director of Economic Workforce Support.
Good morning, everyone. Maribel Klugman, Eligibility Division Director for HCPF.
Good morning, everyone. Barry Pardis, Deputy Director, Office of Economic Security, CDHS.
Good morning, everyone. Nicole Duran Jones. I am the Deputy CDMS Product Director.
Morning, Danielle Henry, Deputy Division Director for Partner Relations at HCPF.
I'm Michelle Barnes, Executive Director of CDHS. Before we go to Kim, we can't see who's on the phone, so maybe there's Deb. Do you guys want to introduce yourself on the phone?
We see Martha, there's Minna. Susie, great to see you all. If you don't mind, if you're attending virtually, if you can put your name in the chat, so we just have a record of who was here in chat. And then Michelle, you want us to expand this to have more folks? Or is that good?
Yeah, how many people are on?
We have 31 participants.
Oh, yeah, let's see who's here.
I have to go down like this, but
I see Tammy, see Mike with Peak.
Right.
We had a couple folks join the room. You guys want to introduce yourselves?
Kevin, you're up, man.
For what?
Intro.
I'm Kevin Neiman. I'm representing CCI this session while Katie is out on maternity leave. So happy to be here.
Katie First from PCI. Hi, everybody. Sorry, you're listening to the governor talk about county admin.
Oh, really?
Really?
With the JVC. You're welcome to share.
Betty did great.
Sorry, he was presenting his budget, JVC, and of course
Got it.
he came up.
Kind of.
He talked about your all investment in county admin. So we're in the zone.
Yeah, and you are in the zone. All right. Well, Michelle and I are going to kick it off with some introductory remarks. I've got a couple of slides to just sort of set the baseline of where we are to ground us in before we start the day. So why don't we just jump to the next one?
I cannot. Sarah literally just fixed it for me. That's good.
Yeah.
Fine.
Okay.
Are you moving it?
I'm not touching it. Try it.
Okay, there we go. Today's agenda, and we'll start with, you wanted this slide, right, Kim?
Let's go to the next one. Yeah, because you guys can go back to this after we do the intro remarks. So I just want to start with celebrating. This has been a really hard period of time with the public health emergency, and then the public health emergency unwind. And I just want to thank you for all the work that you and your teams have done. All of the partnership that we've had. We never had to cover 1.8 million people, 30% of the population. Thank you for that. The systems were strained. You all were strained. We've all taken some heat. I want to thank you for just helping us through this period of time. It's been so unprecedented. We didn't have a playbook, and you guys hung in there, and we're extraordinarily grateful. Thank you. But we're moving out. The sun is rising again. And so this slide, if you look at it, I just wanted to invite you to celebrate May, June, July, August, September. The first line, the renewal rates that we have, it's about 78% at the end of each month. When we look at how many people were actually proven to be renewed and approved, 78%. And it's so much higher than it was pre-pandemic at 57%. We need to celebrate that. So things are getting better. The auto renewal rate is at 63% now for September, 71% for Magi folks. So 63% all. We celebrate that. Things are going in the right direction. Disenrollment rates are half of what they were pre-pandemic at 17%. That's the other side of the coin of the approvals. We need to celebrate that. And the procedural denials down the bottom are below what they were pre-pandemic. Now, the world is not perfect, but it is a lot better than the struggles we had at 1.8 million when things just weren't fully working the way that everybody needed them to, and you all were hurting. And so I just invite you to celebrate that. I want to jump to the next slide to give a little bit more good news as, again, the sun is rising. Josh, let's see if we can get yeah. Are you just going to have to do it the old-fashioned way and hit down? There we go. So on the left side, thank you. The backlogs that we saw throughout the public health emergency are now, you have caught us up. And in the last 3 months of August, September, October, the counties are hitting the marks with 96% of those applications and renewals that are supposed to be processed in 45 days. You're Magi. You're hitting the mark. And also with those under LTSS or on waivers, within 90 days, you're hitting the mark for 3 months in a row. So it means we're the sun's out, right? Thank you for that. Well done. My ask, and let's go over to the right first before the ask here. More good news. So the escalations, you can see how high they were at times when we were at, January, February, March. Since May, where the escalations are at less than 250 a month coming into HCPF across all counties when a provider or a member or an advocate says this person we think is eligible and they can't get through the system. 90% of the time they are proven eligible, but those numbers are so far down. Again, the sun is out, right? We're recovering. I'm going to move quickly to an ask here on the left-hand side. This is critical. So one, thank you for catching us up on the backlogs. The last backlog, the last frontier that we really need all counties to eliminate is that work task backlog, which may have resulted in individuals when the renewal was determined, it may have been determined inaccurately. In other words, somebody may have been determined ineligible for Medicaid or CHIP when they were eligible had that work task been done. So it's the last frontier, and I'll just be blunt. The advocates are on fire. The providers are on fire. The legislature is on fire to make sure people aren't falling through the cracks because the uninsured rate is still higher than it should be. And so this is the last frontier, and I'm asking you to do the best you can to work with Josh and get that task list caught up, if you can, by the end of December. Now, we all got to monitor this because we know what happens in every production environment. When you go into the Thanksgiving holidays and the year-end holidays, you build back up that darn backlog. And so my ask is just work really tightly with Josh to figure out. Some would say, well, how do I prioritize this? We have to prioritize by getting stuff done. This has to be a priority because we have to find those people who are still falling through the cracks. It is the last frontier. So you know that we have performance plans for all of the counties. If you believe that catching this up, and we believe that this work, there's always work on hand. There's always work that is in tandem to applications and renewals. typically that work is done in tandem. If you've gotten behind or if there's peak work that hasn't been done, we've got to catch that up to achieve the goal of making sure people are covered and that we haven't inaccurately determined. That's the goal. If you believe that doing so will jeopardize the monies that we would pay you for hitting your marks on renewals or applications, have a conversation with Josh. Okay, if we have to move something here in order to hit something there, I need us to hit that mark. You need us to hit that mark because, again, we've got a whole bunch of folks on fire. We are coming out. We are in the sunshine. Things are going so well. That's the last frontier of saying this chapter is behind us and we have a new tomorrow and it's looking pretty bright. Now, again, things aren't perfect with the systems. So let's go to the next slide and let's talk about other things to come to address some of those things. So let's talk about the budget. So we have at HCPF $17.4 billion, $5.4 billion general fund. That's about a third of the state's budget. And we're adding 1.4 billion total funds that is driven by 438 million in general fund. And there are departments that would give their right arm to have that much. Now that's because of who we cover, right? The cost, why is that so high? So we are in like the zero budget year with states. We just don't have enough money. So I started a position of extraordinary gratitude that HCPF was given 438 million just to cover the Medicaid members that we have. When we have those monies, 96% of our budget goes to pay our 105,000 providers and less than 4% goes to pay our administration. That is extraordinarily efficient. The typical health insurance carrier would be more around 13.5, 13.6, 13.8%, for almost 10 full points more efficient, which sometimes drives me to drink. This is your coffee, I think, coming. So I think so we are so much more efficient, sometimes to a fault. So really efficient, but what is causing that increase are hospital prescription drugs and professional claims like doctors, behavioral health providers going up, behavioral health services specifically going up, long-term services supports going up, and our Medicaid enrollment after we come out of the public health emergency and we disenroll those 519,000, it's going back up again. So the average cost for the people that we retained or came back on are more expensive than we thought they would be. And that's a trend all over the nation. Plus, we're adding Cover All Coloradans, which is a plan that will cover undocumented kiddos and undocumented pregnant people effective January 1, which will add somewhere in the fiscal note around 17,500 people. Now, compared to 1.3 million, that's not a ton, but it still is an impact to the budget going on. So now I want to get to the important part to you. So 40 plus goals, 125 projects or so are going on at HCPF at any one time. Let's go to the next slide. What is the most important of all of our budgets in our discretionary area? It's the amount of money to cover what we built together, CDHS and HCPF, and the counties working together. What do we need to get the counties properly staffed and better income coming in? So that funding model is the biggest discretionary ask that we're going to talk about in a minute. We'll spend more time diving in to answer all your questions. The governor just hit it this morning, as we heard, but that is not a standalone, that budget request that we have. It's in complement to, on the right-hand side, trying to get that automation up, right? We said about 70% of Magi folks are in that ex parte audit. We want to keep driving that to like an 80%. That's a Kim guess. Maribel's going to know a lot more. We've got 2 consultant firms helping us trying to get that automation. What's the goal? Governor's wildly important goals: reduce county workload and improve the member experience. So we are continuing to invest in that, right? We want to improve peak. We want to improve ex parte, everything we can do to get that right-hand side to do those 2 things. Again, governor's wildly important goal. Michelle and I don't have any higher goals than what governor's wildly important goals. Next, JAI, right? That's funded, comes in 26, 27. Unite a single unified system to track work tasks. So we have more optics. Right now, what I asked that I just had was, we can't see all of that. We need to lower that going forward, get that cleaned up by December 31. That's the goal. Going forward, we'll be able to see that more clearly if we work with you constantly. Right now, we're in this in-betweener. We can't see it. Thank you for your partnership there. We'll have that 26. That's already funded. And we have a document retention system single. We can put artificial intelligence, find the birth certificates, find those pay stubs, have the system doing that. Again, what's the goal? You've asked us to help you reduce your workload and improve the member experience. That's already funded, right? The vision we're creating together on CBMS, so we know where that's going, and we're trying to improve the correspondence. So lots of work to make that better tomorrow, all funded, all going on right now. So let's go to the next one, which is show me the money, honey. So with that, before we get into that budget, let's turn to Michelle for
Wow,
comments.
I didn't bring slides.
That's
guys.
okay. I'm setting us up. Do your thing.
No, that was great. So what Kim said plus a few things, I want to talk about, some good news. So as of this week, last week, Abby, we hit,
Of October.
yeah, we hit 90% timeliness on SNAP. So let's just start why we're here. We're here to get SNAP, so people are getting the benefits they need in the timely manner they need. We hit 90%. We were low 70s in January. So just think about how much work that was by all the counties to get there. We're starting a new thing, but we don't have t-shirts yet. But we're calling it the 95% club for counties that hit 95, and which is the goal, and stay there. So far, El Paso and Jefferson are in that club. I think perhaps a trip to Mexico or Puerto Rico.
Since we hit the 95.
Then you guys. Guess we weren't invited. The good news is we're making progress, and we're continuing to do every other week meetings that include the CBMS folks. So we're looking at all the levers we can take to get out of our federal cap, to get to 95% and sustain it. So this is great news. If you'd told me when we launched this back in, gosh, when were you hired, Abby?
January.
Yeah.
January. In this job you're in January?
No, June in this job.
June. Yeah, when Abby started this job, I would never have guessed we'd get to 90% that quickly. And we are, and we're seeing really great things in the county. So thank you. But we're going to keep pushing until we get to 95%. And as I like to tell Mary, overtime is not part of our getting to and maintaining 95%. It's not a sustainable business model. So it's a short-term measure to get us there, but we need to be more clever than that and come up with ways to get to maintain 95%. That's not on the backs of the people that are, doing the work. So you have our commitment on that. So anything I want to add to what Kim said is we did make a pretty big structural change that we decided a couple months ago, where we understand there's a lot of concerns about CBMS and how it's organized right now. There's kind of a HCPF team, and there's a CDHS team, and there's people from OIT coming in, and then a lot of our legislators care deeply about it. I care deeply about it. Kim cares. We got a lot of cooks in the kitchen. So we've decided to have one cook in the kitchen. And that's our new head of product, Nina Mack, who's coming out of Boulder County. So I didn't see if Boulder was on the call, but she's going to be the person that where everything comes together on CBMS, whether it's technology, county concerns, strategy, JTC presentations, getting out and listening to what you're hearing from your clients. That is the new function we're adding. So as I like to say, I don't think she realized she's reporting to both Kim and I. God bless her. She's going to be directly reporting to us, so we can make sure there's absolutely no barriers to making the progress we want to make on CBMS. So very much looking forward to that. She starts in a couple weeks, December 2nd. So we're hoping to see more of a focus on CBMS, because we have somebody dedicated to working with you guys, working with us, and making sure things are moving ahead. That the team that's doing CBMS now will stay as they are. They all have full-time jobs. So this will be an addition to what they're doing. So happy to take any questions on that. And then I think Kim covered everything. So I'll pass. Are you next, Megan? Sure. I see it on the resume or on the agenda.
So first of all, thank you for continuing to convene us together. I think it's been really a great way to underline our partnership even more. And we heard you say, I'm getting you county admin, I'm going to get you CBMS improvements, and you showed it through the budget request. So thank you so much for following through on that commitment. to counties, but really supporting the members and the families and the individuals that come into our offices every day by supporting those frontline workers, giving them the tools they need to process those applications timely so that we can get those services to the people who need it most. So thank you for that. And we're excited to continue to dive into how to move forward with some of these other recommendations. We are strong partners, and strong partners don't always see eye to eye. So we appreciate the ongoing dialogue and really facilitating that for us.
Awesome. And thank you all for joining us today here at HCPF. I think this cadence of in-person, just relationship building and staying aligned and building strategies together and understanding each other and just doing what we need to do. And these are hard times that we're coming into, right? We're coming out of Feast, which is all the federal massive stimulus dollars, and we're back to typical days, which, and if anybody's been in Colorado government, we always live in famine. There's never enough dollars. So we are in famine, plus we have an administration change in the federal government and a really tight budget and interesting things on the budget. Like we had a ballot measure that is a really neat thing where $350 million will help public safety, right? Police. But the $350 million needs to come from within the budget, which wasn't really funded. And there are a couple of big areas they look to. Right? Us, education, we have to figure that out. So it's going to get tighter and tighter. So as we walk into this budget portion and as we go through this agenda, know that, boy, we got to fight for every dime. And I appreciate the partnership in making sure what we have made the most important thing between HCPF and CDHS, the number one discretionary item, which we are going to bat together with you. We all have to win this fight. Everybody's going to be knocking on the door. And again, on our budget, you didn't hear the governor say an across the board increase. We have 105,000 providers that we did not give an increase. It's coming into yours. Just to put that in perspective, it's about $31 million for every percent. And there's about $33 million in the county budget request. So I've been I'm an athlete, so basketball, you telegraph a pass when you say, I'm about to pass over here. I've been telegraphing that pass for many months now, providers. You need to get behind the counties. You need to get behind the counties. And I've called and made those calls to ask them, but together we need a unified front. So with that, Josh, you want to start diving into the CDHS side and then the budget side for 235?
So the content that we're going to share is not new. We have had a couple of weeks of engagements, so it's going to be old content. But what we wanted to use this time for was really to open it up to questions, comments, dialogue around what is in the budget, and then we can go from there. Just go to the budget section.
Sarah, is there any way you can just send us the presentation so I'll have to log on? Thank you.
Right, Shelley, is this you?
I would love to. So as Josh said, a little bit of this is repeating some of the things that you've heard in several other venues, which is great. And I do want to make sure, rather than I think hour we have allocated to this, that Josh and I are presenting to you, rather we have an opportunity to talk about the budget, to hear, where there is appreciation, but also where you still continue to have questions, so that we can make sure. And I loved that, what you just said about strong partners will disagree. And I think it will be good for us to know just what that narrative looks like so that we can have that united front and be supporting the budget requests that we do have out there. So our budget request from CDHS, which is R1, is an investment of $4.2 million to the counties. This is aligned with and built from the funding model. And we recognize that compared to HCPF, it is half of the request that is in the funding model. For all reasons that we've already talked about, this is a really tight budget year. So we wanted to show the commitment to increasing. The state has invested $16 million and made that ongoing for county admin already on our side. This is the bump that we could work into the budget with the constraints that we had. But we are recognizing the work and funding and commitment that it took to get the counties to 90% collectively and 95 for some of the counties that are here in the room. And we recognize that this ongoing investment is necessary in order to help you carry that work and just the day-to-day work. So I hope you see that in our commitment. We also know that there has been 35% increase, and that will continue to be our narrative as we share and ask for the request of the Joint Budget Committee, the support from the Joint Budget Committee with this request. And then the one other thing that I want to just underline and emphasize as we look at HCPF and CDHS's budgets, we are able to draw down a 50% match. And so that matters a lot and was part of our collective strategy and how much we are asking from the general fund. The general fund goes a lot further with our HCPF request. So I think that will be part of today's conversation as well, but happy to talk through that. And then, Josh, I'm going to kick it over to you. I don't like going then the next part and saying we're part of the HCPF request because it feels like it steals a lot of your thunder from your proper request, but we are really happy to be included and to be supporting and benefiting the counties through our portion and partnership in your request as well for technology enhancements.
Well, you can certainly steal the thunder. I wouldn't disagree with that. But to Shelley's point, our general fund dollars on the Medicaid side go a whole lot further. So when we're talking about eligibility determination staffing, we get a 75% federal match on that. That means we really wanted to emphasize pulling down those federal dollars. On the system side, we get a 90% federal match, which means we are truly minimizing the impact to the state general fund, which is why these components, although they're shared components or a joint request, they were in HCPF's request in order for us to get that 90% federal match. But one of the biggest things that came out of the 235 study was how difficult it is for workers to navigate policy. Complex policy across the different programs, how regulations aren't necessarily aligned across the programs, and Lord knows with the federal administration change, I don't know that that's going to get any better anytime soon. So our focus here has been trying to provide an automated solution to help workers navigate policy. And that is what we call PANDA. Program Area Natural Dialogue Assistant, I believe it's what it is. And it is literally like an AI chatbot where if you have complex questions around policy, put it in the chatbot, and the chatbot will pull from all of the sources that we populate in it to spit out a answer for the worker. So I will say, I attest, I have searched for HCPF memos, and it is extremely difficult. Sarah's working on a solution for that. But the better solution is put all the memos in Panda, and Panda will search through all the keywords to get you what you need for that case that they're working on. We also know, and kudos to the CBMS team, because it has not been an easy couple of months for them, but they have been doing phenomenal at trying to manage the feedback that we're receiving, adjust the system, but we did get some things in here for CBMS. So one thing that we wanted to prioritize was reducing defects from builds. This automated testing allows us to expand the scope of what we do in user testing, which is done by people, but do it in an automated way. So that way we can potentially find defects in the system before they're pushed out in builds. The other thing that's not on this list is, I'm sure, who knows what a 237 error is or has heard of it? Everybody. 237 error, correct me if I'm wrong, CBMS team, but that is a data sync issue. So what's on the front end of CBMS, what's on the back end, and they're not syncing together. That's the 237. We are actually in the requesting funding to replace the components that cause those 237 errors. Will they be completely eliminated? Likely not, but it'll be better than it is today. To Kim's point, to Michelle's point, a brighter tomorrow. And then also to Kim's point, all of those documents that you receive, we don't have visibility on. The enhancement, or the expansion, I should say, of intelligent character recognition allows counties to receive those documents and for those to be mapped automatically into CBMS. So you're not manually entering 1, 2, 3, 4 from a pay stub. It gets mapped to the field. those were really exciting components that we drew down that 90% federal match for. There is a CDHS pay for that as well. But any questions on the CBMS pieces or anything that Tiffany, Nicole, or Ms. Ghana want to add on the CBMS components?
I'll just add, it's pretty exciting, those last two items and getting funding to look into those technical issues. I know for automated testing, it doesn't take the humans out of the process. It goes through and does a major part of the work, and it allows the testers to actually dig into what the issues are and spend more time personally interacting with the system to see what's going on, interacting with users to see how it should be working and all those types of things. So that's really exciting. And of course, intelligent character recognition, that's where the world is going, right? So that's very exciting as far as gathering data, gathering documentation, reading documentation, some of the things that Josh was talking about as well. So I'm very encouraged and excited about utilizing all of these budget enhancements as well. So.
Yeah, very well.
Yeah, and I'd like to add on the intelligent character recognition, shout out to SNAP and my CDHS partners that have already, started down that pathway and opened up that road. And, medical assistance has a very small portion on that. But I'm excited about being able to take the partnership further and being able to see what's worked, what hasn't worked, what can we do more, better, less different. And with that, the partnership with you all, as far as, for us to all really make it the best successful tool for all of us to be able to really streamline a lot of this. So just want to put that plug out there as far as that, looking forward to that partnership and think about what's working, what's in place now, and then what the future looks like as we move forward with that work.
I could just add one thing. I think you heard me and Michelle and others say on mic. CBMS is not old technology. CBMS has really been maintained with updated technology. And what I said on mic was, put to bed the myth that it's old technology. What we need to invest in is all the things that are built around CVMS to make it better for the county worker, make it a better experience for the member. And so all of those things that we're talking about, you're seeing the beginnings of all that neat stuff that's built around, and these strategy sessions are really important to say, what's next? What's next? What's next? And to replace the entirety of that big thing called CVMS is, I can't even put a price tag on that. But and knowing how tight this budget is, the clarity into how can we get a better tomorrow by building the things around it that bring you a better experience, that bring that efficiency, that bring more accuracy, that help the members get through the system. That's where the strategy really needs to be focused on. And thank you very much for just continuing the partnership of saying this doesn't work, this does work. And we just got to keep working it together.
Just want to note for folks virtual, you can always raise your hand if you want to ask a question or jump in on anything. Anything else on the joint CDHS HCPF pieces? Okay. On HCPFs R7, so I just wanted to know, R7, even though it's not R1, doesn't mean that it's not our biggest priority. Our next requests are standard for our caseload and our medical services premiums. So those occur every single year that we have to report to the JBC. We need X amount for medical services. Our discretionary requests usually start at 6. So number 6 was our ACC phase 3. Number 7 was county admin. But as Kim said, the county admin one far outweighs any other funding in any of HCPF's discretionary requests. So the 235 funding model said that on the HCPF side, we are underfunding counties by $21 million. And that is exactly what we requested in R7. But remember, our general fund dollars go further. So it was not a, I mean, if it was 50-50 split, that'd be like 10 million in general fund, right? The total request in R7, including all the CMS pieces, was only about 4.5 million general fund. That 4.5 million general fund turned into 35 million total funds. That's how we maximize those federal dollars. Another CBMS thing, but more on the HCPF side, is our county partners over the past year and a half, all have been instrumental in helping us identify where there are opportunities for CBMS to work better for members, work better for workers. But part of our roadblock on the HCPF side is we literally didn't have the resources to do anything with those requests. In our last work session in July, we talked about how we prioritize, which is literally compliance. If we put at risk any of those federal dollars, then that has all these downstream impacts. But we heard you, and we heard you loud and clear that we needed to have additional resources to operationalize some of the requests that you guys had talked about, or some that our members or advocates have requested. So HCPF received approval to include in the request a 10% increase in our pool hours for CBMS. Now that's not a lot. Maribel, correct me if I'm wrong. I think it's like 200,000 total annually. And that meant that 10% gave us 20,000 more pool hours, or 5,000 more a quarter, because we're going to quarterly builds next year. A major build is more than 5,000 hours, I believe. So it may be a couple of extra projects we can squeeze in, but we do want to make sure that your voice is heard when we are operationalizing those projects. And I do know that there was a county question around how those are going to be prioritized and whatnot. And this language is in the budget request. Because HCPF is a single state agency, we still prioritize those pool hours. That is HCPF's decision, but it needs to be a different process than our regular pool hours. So that's where we're focusing on federal compliance. Maribel has lots of projects teed up for this big federal regulation set that passed before the Congressional Review Act period. So we do not believe that those rules will be impacted by the federal administration change. Sorry, I lost my train of thought. 10% increase in the pool hours. That just means you can have that voice through CBMS, ESC, and all those related venues to say what should be prioritized. HCPF may still say this needs to go first, but we want your voice at the table, making sure that we're hearing what you're saying. Kim, you want to add anything on that?
So, there's 175 to 250,000 in backlogged work. And that is just so maddening. And so we're just trying to figure out, do we take from county worker staff and wages to put that? And we said, take care of the people. And we're just going to have to incrementally increase that over time. And we're hoping with, it's really hard. We have to look the legislators in the eye and say, I'm sorry, we can't get to that for 3 years. And it's going over like a lead balloon. So when they won't agree and they push something up earlier, that might bump something that we all want to do because a darn bill jumps ahead of us, or a CMS requirement jumps ahead of us. And I'll just apologize in advance. We just couldn't eat the whole elephant of 250,000 or 175,000 additional pool hours. So we're just going to have to do it step by step.
As part of the roadblock, as we had shared early in the year, is we can push in all the money we need to in CBMS for development, but we need the staff at HCPF to actually operationalize the projects. We can't do that without, we can't do a CBMS project without the policy or systems piece. So that the FTE in that particular area, or for the CBMS team and for Maribel's team, to support those projects, those new 20,000 hours a year. Also, you all had great feedback on the SNAP IVR system. Thank you, SNAP team, for operationalizing that. We know that HCPF tracks and monitors county call centers, wait times, all that good stuff. This new IVR system is intended to help alleviate some of the pressure on your county call centers. So just like the SNAP one, they could call in, get eligibility information and stuff like that. Hopefully that helps you divert some of the work, some of those easier calls to this IVR line where you can deal with the complex calls in the call center. We also included funding to permanently staff our county escalations process. Kim went over the data for that. There have always been complaints and escalations. I'm sure that's true on the CDHS side. That's true on the HCPF side. That was true pre-PHE, during PHE, post-PHE. We know, and at least what I wrote in the budget request is, we probably see about 200 to 300 a month in complaints and escalations from members. That's our kind of normal. Well, lo and behold, that's exactly where we are in our new normal on our data. But this has been a point of concern from our advocate community, that they were under the impression that those resources were term limited, which they are right now. And that once those resources went away, it would be back to having to navigate the county by county process, which some struggle with. This permanently funds that escalation team and gives counties direct access to our Salesforce system. So that means where we receive all our complaints and escalations, we're going to give a license to each county, and you can work on those complaints and escalations directly in our Salesforce system. And for those counties that are case management agencies, they also will receive a license. So you have the financial eligibility complaints and the functional eligibility complaints all in one system. Because I know when I get an escalation from a member in LTSS, it's often not one side or the other. It's likely both. Something on financial needs to take action, something on the functional side needs to be taken action. So combined in one system, we can see all the work together and we progress the work instead of siloing it out. This is more administrative resources, the last bullet on HCPF side, which is in our 235 response to the year one recommendations. We reported that based on the feedback in the 235 report on county communications and engagement coming from HCPF, that we needed additional support in that space. So I'm grateful to say that those were included in the request, and that means hopefully, like on the HCPF side, we don't have a county portal the way CDHS does and the way everything is in one spot. We're going to get to it with those resources. We're going to improve memo series with those resources. We're going to do all of the communication steps that we need to take to improve communications with those resources. Because I know right now, my team is not staffed for that. And so that's what we're trying to do, is make sure that we're engaging and communicating in the ways that you guys expect us to. Finally, complex cases. That also was loud and clear in the 235 report that LTSS cases or cases with multiple programs in LTSS or whatever that combination is, some counties struggle with the complexity of those cases. Literally had an example on my desk last week working with a county where they had asked for support from HCPF. The support we provided wasn't sufficient. It wasn't good enough for that case. Now, the training document that we referenced was correct. But guess what? In that specific circumstance, there was other variables that the county didn't take into account that meant the case was incorrectly determined. And then when they reached out for us for help, we couldn't help them the way they needed that help. It had to get escalated. I had to get involved. Finally, we got them the answer they needed. We were able to correct the case, but that was just a glaring example of how HCPF needs to do better supporting counties on complex cases. Because sometimes policy or PANDA even isn't going to help, because these LTSS cases are so individually specific that broad policy doesn't address everything. Okay, so on that, any questions on the HCPF components of the request? And of course, there was the broader deck that we shared that included everything. Yeah, Kevin?
So this is more of a CDHS question. So the pool hours for HCPF, what was the rationale for not doing any pool hours for CDHS, CBMS fixes? Are there none in the backlog for SNAP or?
No, there's certainly a backlog. We were prioritizing our county admin first and foremost. And the other component, as Josh mentioned, is just the federal match and drawdown. So general fund monies and the ask in a tight budget year, we get a lot more from general fund when HCPF is requesting and investing. So that's where collectively we put the priority this year.
Showing.
I think at a really high level, and I'm clearly not in the weeds on a lot of this, but I think the thing I'm still trying to wrap my head around is how the two departments are going to work, but how this works across the department. So like there's in the HCPF request, there's a lot of FTEs for HCPF to work with counties and work with CDHS, but then there's nothing on the CDHS side. So like, is CDHS resourced to kind of help do that cross-agency collaboration and making sure that things are aligned, or like, how is that gonna work?
Mm-hmm. Yeah. So again, it came down to helping to balance the budget. CDHS does have some of this already resourced, but not to the extent that that would be needed in order to really do the investment. But there's more drawdown from federal funds on the HCPF side on CMS. And so in order to balance the budget, we knew we could put more money into HCPF than we could with CDHS. And that's where we focused our efforts. We also believe that when counties are better supported in one area, we hope that there's a balance there too, where if we can't have resources on both sides, but there are more resources on HCPF and county admin and those areas that a county will feel some in order to help manage their work there as well.
Shelley, just, sorry.
Go ahead,
To
Mia.
add to that, it doesn't help with SNAP process. No. So I think that's it does help overall with the coordination. It helps with CBMS. It helps with streamlining things. So we're half our way to the SNAP CDHS request on the funding model. So, but we're also still, as we said, we can't sustain on overtime and we're not at our 95%. So while we see this relief and resources and a significant support, so thank you for this. We're also seeing that we're short and we have a gap and we're under a corrective action plan. So to me, you can understand that stresses me out. And thinking about
It does me.
done to get to where we are, to sustain that and to get there statewide. So we have a gap. So I just want to be real about celebrating and this is huge, but I am concerned about that SNAP side. So I just want to put that out there.
So are we, and Kate, if I could take your question, right, you're saying, how can you ensure that we're going to play right and that the fact that we've got additional funds in the HCPF side doesn't really help SNAP timeliness? It does, but it doesn't.
It's just like,
We're going to play well together. And
you know, a lot of it is about coordination. And so who are they coordinating with, I guess is really my question. And how is that, what is that actually going to look like for?
I'll just throw out a general statement. The counties work in partnership with both departments and counties have to do the role of both departments' requirements. And that's the hard place that you're in. That's why I said on our side, you're welcome to talk with Josh. If you have to sacrifice in order to catch up these work tasks, to get rid of that last frontier and put this damn chapter behind us and get providers and advocates that we can say, that is cleaned up. This is the new normal. And people have to get attached to other coverage because they're not eligible for Medicaid. Bad. Right? If you have to work that out with Josh, here's your allocation and here's your time with HCPF and here's what you have to, and you have to move some of our levers, then work that out with Josh. And I'm willing to say, okay, if things have to drift a little bit on apps and renewals to catch that work test, and then we can work on getting that back to normalcy over a period of time. From the two sides, I'm just going to put it out there. You have to manage both. You're in place to manage both, and it's hard. And you know, if you have to bring us together or you know, Josh and Shelley to figure something out, you've got to, and I don't know if you want to add anything to that.
no, we recognize it's not ideal. And it's the best we could do. So it doesn't solve the problem for you or for the state or for the people needing benefits. And so we would love to figure out how we're going to make that happen, but we don't have a ready-made kind of what Kim said is.
But we are trying to like HCPF relying on SNAP eligibility and then making determinations on ours. So we are trying to, and that's why we're trying to automate, right? All of the work going into this so that more things are done behind the scenes and there's less that's the work tasks and the individuals. So, yeah.
If I may add, I mean, you know, we've done this in the past and we will continue. I mean, there's quite a bit of work as acknowledging that a family is a family. It's not a Medicaid or not a SNAP. It's a family, right? And so in the past and commitment going forward is whenever there's projects, although it says HCPF CBMS pool hours, if there's any potential benefit for our SNAP partners, definitely that's where we, you know, have the conversations and we have a lot of different meetings that we, you know, connect and engage with each other. In the past, there's been projects where we said, hey, this may have a 10% SNAP, you know, hours. Can we use your already existing pool hours? Because they still have that existing pool hours, you know, where HCPF may pay 90% and maybe SNAP contributes 10%, but then we all benefit from that, right? So, you know, we've already planted the seed. Abby and E and myself talked about it the other day about IVR. It may say HCPF here, but we want to make sure we have engagement with our teams to engage of how's it working today?
Yeah.
How do we make sure, how does HCPF implement it? But then how do we make it cohesive going forward? And if that means that there's some parts, maybe, I don't know, I'm making this up, Abby. I don't know all the details, but you know, as part of the partnership.
But on the CBMS side, a little bit more clearly, it's, I think I'm thinking more about the 235 phase 1 recommendations, because a lot of it is about streamlining and finding efficiencies. So Just trying to think that through.
And Katie, I will say, although HICPUF did have requests, a resource request for that in that space, that's work that we're already doing. So Abby's team, Ian's team, and my team is already talking about how we conduct oversight. So our any reviews and how they can do things differently on their side that align with us or us align with them. So some of those conversations are already happening. The HICPUF resources that are attached with that are more to make sure those are sustained. Because one thing Kim said is in our 4% admin, only 0.5% of that is HICPUF staff. So we have a $17 billion budget and we have 700 people to manage that $17 billion budget. Means a lot of us do 3-4 jobs. That is giving us some space and capacity to sustain the work, where CDHS may have the resources to at least advance some of the work now as they think about what those next steps are. And Abby, I don't know if you want to add anything or.
No, just I think you're right that we are looking for opportunities to align and coordinate whether or not they require resources to support them. And I think there's a lot of that potential for our teams to work better, have fewer county touches. We don't need to be sending all 3 teams out separate times a year. We could all go at once and get the information we needed. And those don't really fit into this budget request piece, but it is work that's ongoing.
One of the things that I think is coming up on our side that county directors haven't had as much time to sort through yet is one of the 235 phase 1 recommendations. This number 3 is specific to hiring and retention. So that what was in the phase 1 report versus how you all are choosing to implement it in the budget request, there's some concern that it has such a heavy focus on the LTSS population and having a contractor look at breaking out those different pay scales. A lot of counties so far I'm hearing that just simply will not work for folks in their pay scales and structures. And it's just an item we haven't really had a chance to have more conversation with you all about. And I think we would like to when that is appropriate. We're super excited about recommendation 3 with moving forward with having additional contractor support to look at the pay scales for eligibility staff. But I think the focus so heavily on the LTSS and breaking that out is the piece that I don't think we have agreement on yet. So
let's just talk about that a little bit. So it's, less than 5% of our membership drive an extraordinary amount of work. The sophistication that we need our county workers to have to be able to do that work accurately and timely is different, especially as we automate going forward. And so I would like to challenge you to find your way to the yes, because if we pay people at the same rate that requires so much more expertise, we have a better chance of losing those people, which is where we have errors. And the errors in the future, right? We got very lucky on the last round with the perm audit where CMS said, well, the way that it fell, we're not going to give you any financial penalties on that. The next one, we have no grace period. And so there's literally hundreds of millions of dollars that we clawed back in a perm audit. So my issue is please find your way to the yes, that these folks must be more seasoned. And we have had a really hard time, you know more than we do, of holding on to people. And so to pay those people more because they do need to have more qualifications, to be able to make sure they know what they're doing, to be able to make sure we prevent those perm audits. My ask is that we figure out the how, not say no, because there will be a very different new tomorrow as we keep automating the low-hanging fruit, then the complexities of this small percentage of people that, by the way, they're also about 40% of our costs. So the individuals that you're going through are also have extraordinary need. So my ask is that please try to find your way to yes, to be able to say these 2 jobs, even though this person has to be so much more seasoned and have so much more knowledge, is going to pay the same. It doesn't make any logical sense. We look at every other job that there is, every job at HCPF, jobs at CDHS, you move people based on what they need to know. And so to say that everybody's equal when the applications are so much different with the 95% and 5%, my ask is to say, all this is changing. To say, I only am going to use how I've done it in the past. My ask is to say, how do we change the positions doing this really important work to change with the technology changes that are going on and with where the errors are found and with where the penalties are coming down from the Fed.
Real quick, I think Mary, did you have your hand up before?
I appreciate that. And I think we know the complexities of that work. I think there's a lot of nuances. And I think one of the things makes me think about is where are we at with the recommendation on the workload study? And how would that tie into being able to determine some of this? And so to me, there's just a missing kind of component there with this without knowing kind of where the workload study is and how that could inform kind of what needs to happen with this body of work.
Mary, when you're talking about workload study here, and I have Jamie with her hand up, so I'm going to go to Jamie.
I'm channeling Jamie. Yeah.
When we talk workload study, you're talking time study, right?
Time study, yes.
We've intentionally tried to avoid the word workload.
Yes,
There's certain things for certain people, but you're absolutely right, Sam. We have an appropriation.
It was
annually
annualized back into the budget. Yes.
Perfect. We have an appropriation annually for the 235 funding model updates each year, but the appropriation we received probably isn't going to need it. The whole thing is going to be needed for that update. So what we've discussed is there flexibility in the appropriation we received to do an updated time study, which was one thing that counties requested, and to do an updated, actually not even updated, a first salary analysis that gets to Kim's point. So you're right, Mary, those two are tied together. What salary should be, how much time we're taking to do the work. I mean, I'm sure your workers can tell you, I may spend an hour on a Medicaid renewal, but for an LTSS renewal, that could probably be a couple hours that they're spending. And that all needs to be input into those two studies to say, what should that result be? And with that being said, I'm going to go to Jamie. Jamie, you're up.
Can you guys hear me?
We can.
Yay, it wasn't working this morning on the 8 a.m. call. A couple things about the LTSS worker increase, and I'm just going to piggyback on some of Heather's comments. I think that we accommodate for the complexity of LTSS in other ways at the counties. We know that it takes a little bit longer to process, and sometimes to process an LTSS case. And so we have, maybe smaller levels of expectation in terms of quantity of cases that are processed. But by increasing just a particular set of eligibility work really limits our flexibility to do that cross-program work. So we would not be able to potentially pull an LTSS worker to just do Magi or just do food. In addition to that, there are other programs that also have higher levels of complexity. Adult Financial in Colorado Works. We could argue that those would need an increased amount as well. I think the point is, and then of course our smaller counties have not enough workers where they could dedicate one FTE for LTSS only. And, that would really, again, limit their flexibility to be able to work across the different programs. So since we haven't had this conversation and really fleshed out all of the pros and cons between the state and county perspectives, I think, we really just need to talk about it. I don't think there are a lot of counties that are in support of this. And I think we just want the space to kind of express the why.
So my ask is maybe we put together a small team. My ask and my challenge is try to think your way through to the yes. Match the structure of the pay in the counties with the technology that's driving a difference in how work is coming through, right? All of the automation going on. Can you step in? And I wouldn't say it's designated to me and dedicated. So dedicated, if you're a big county, plenty of LTSS to go around. It's not like they stop coming in, right? So dedicated and designated. Small counties would not have ever dedicated. They'd have designated where they're extra trained, they have the qualifications, and we know we got less of a chance of the errors, and we'll probably have a more speedy process for the most complicated. Also, people that can help individuals with all the right information instead of having to go through all of the difficulties of understanding how do you find all the data and the answers for the person sitting in front of you. So my ask is please put the yes hat on and see what we can get towards designated and dedicated. It doesn't mean they can't work on something else. It means that we're recognizing that these folks are extraordinarily complicated and they also have SNAP and they also have the other stuff. It doesn't mean they can't work on that. The bulk of those folks are also going to have a ton of other programs. So just, if I could please just ask you to put your yes cap on and help us get to the tomorrow that we're talking about. It makes a lot of sense from a risk mitigation perspective, and the penalties that are coming down are in the hundreds of millions of dollars. They're not in the $2. They're in the hundreds of millions of dollars. Anything over 3%. 3% error rate. That's where the penalties start.
Question from Donna in the chat. So it's more about a worker who programs, how would that be coded? So that's a very, technical question, Donna, that I think to Director Bimsteffer's point, none of that has been decided. The concepts are in the budget request, right? But for us to operationalize what that looks like requires your guys' voice at the table for us to get to where we want that to go. I would challenge counties, though, to rethink how they're looking at this particular piece. This is about, from HCPF's perspective, not just paying LTSS workers more, but do you have the right amount of LTSS staff at all? Because they are complex cases, because they take more time, HCPF is looking at this as a way that we can adjust the funding model to potentially get you all, if this is what the data supports, more funding for LTSS. Because as Director Bimsteffer said, as automation increases, you guys are seeing less and less MAGMA cases. 70% automation on MAGMA. 1.3 million people in that. That's 70% that you don't ever touch. Once we get to 80, Marva, I'm not even gonna say 90, we'll stay with 80. The scope of the population you're gonna serve on a day-to-day basis is treating those more complex folks. So let's think of the funding model as, you know what, this is an opportunity for us to maybe get some more funding to work these complex cases. And I'll go to Megan.
So I'm not saying we can't find a way to get to yes, but I think the points that you're making are accurate across the board, that as more things are automated, as more system improvements happen, all of our cases are getting more complex and complicated. Like the easy cases are happening pretty quickly and easily. And what eligibility workers are left with are really messy SNAP cases, really messy TANF cases, really messy Medicaid cases. I was just looking at you, Ian.
It's the reason I don't know what we're talking.
So I think, yes, we need seasoned workers across all of our programs, and we've been trying to elevate the professionalism of the role in general. So yes, and I think there's got to be some way of recognizing all of that it's not just LTSS cases that require that extra expertise. And even if say Eagle County is paying their LTSS worker at a tier 3, and we've got 3 tiers of eligibility workers, and then we lose our LTSS worker, having it paid more isn't necessarily going to be able to get that expertise right back in there. So I think it's yes, and there's got to be some other ways of addressing that need for expertise as well.
And I think it's important to not do all of this work in a silo, right? So you guys are saying the complexity of the cases in the other programs can translate to the complexity of cases on the Medicaid side. So that contractor work is not going to be done separately. It'll be done by the same process that we do the funding model update, do the time study, update all of that good stuff. Ian?
Josh, keep me honest on this too, right? But when you think about this in light of the big picture budget context that's been talked about, is it fair to say that there was political support to be able to accomplish this too, where we may not have the same level of political support for these other areas or the programs at this time? So maybe it's recognizing that this piece, while not solving for the full issue, is a step forward that maybe we couldn't take in other areas or other parts of the ecosystem. Is that fair?
That is very fair, Ian. So one thing that is a huge political undercurrent right now is this frustration from LTSS members and advocates of the state county system as a whole. And the opportunity we had here was to say, rather than you think about, they're thinking about, do we even want a state county system? We're saying put that to the side. Our solution is making sure counties are properly resourced and that the pay scales reflect the complexity of the work. Now, does that, when we look at the programs holistically, does LTSS pay require more? I would think when we look at Medicaid only, yes, but maybe when we look at all programs, maybe not. We don't know. That's the point of the contractor and study and analysis, is for us to look at everything holistically and then spit out an outcome. And I just want to also reiterate, HCPF nor CDHS has the statutory authority to set county wages. That is only the Board of County Commissioners. So we may produce a recommendation that says you need to pay LTSS more, or you need to pay TANF more. It's still up to you guys with your boards to determine what that should look like. Where HCPF is really focused, it's less so on the salary piece, it's more on the caseload ratio. And that is, from our perspective, the ability to get you more resources to manage less cases. So one county may have 40 LTSS cases per worker, another county may have 100 LTSS cases per worker. If we standardize that, and then we say, you know what, everybody's only supposed to have 20 based on the duties that we're going to define for them, then that means that if you have more less than 20, we can get you more resources. But those have to be conversations, that has to be an analysis, and that has to go through the regular budget process. So even though we're talking about LTSS salaries, the funding for that isn't there. It is only the contractor analysis at this point. We would still have to pursue through the regular budget process, whatever those next steps are. Katie?
I appreciate that a lot of this is coming from the advocates. I think I'm channeling the directors here, so kick me under the table. But this wasn't part of 235, so we're just trying to wrap our heads around what it means. And I think this was an area, even when 235 came out, we were trying to understand, like, how is that recommendation going to interplay with the fact that the VOCC set salaries and things like that? And so now there's this kind of like added piece of like the LTSS cases. Is that a fair characterization?
Yeah, I think it feels a little like that the direction is predetermined when we haven't had the conversation about really what we actually want to look at with the contractor as those next steps. And I think it's hard without the time study piece that's really has that concrete data informing what you all are saying anecdotally and being able to counties about that. I'll just say we have heard so many concerns from counties about like how it's would be like very, very hard to operationalize. And so it feels like with a predetermined direction, but not backing up to have these conversations, that's the piece that is hard right now.
We just had a couple folks join us in the room, Lisa and Rachel. So to that point, Heather, although it may be written, that's maybe the tone you guys are picking up, there is no predetermined outcome. Because to be honest, it could give us the outcome that you think we're aiming for, but there may not be a budget for. So our intent here is really to understand the full scope of the problem and how it all interplays together. And then for us collectively as a system, as Kim said, to find a way to get to yes, in some semblance of the broader system that we work in. So none of this other than actual committee probably, and we haven't even discussed that part, right? Like this should go through the regular committee process we have for 235. It's just a HCPF specific scope of work that we're going to tack on, but should be the same sort of committee decision-making and stuff like that that we would use to make sure your voices are at the table.
Have you all thought about what that's going to look like?
Sweetie.
Shelley, as a whole, have we thought about what the coming 235 years look like?
I mean, it's certainly something we're continuing to track the progress that we've made on phase one, what things are incorporated into the budget, what things we're already making progress on. And I think in the next couple of months would be happy to give an update. Maybe that's what we do at the next one of these quarterly meetings, is to dive into phase one recommendations, the progress that's been made and the path to make progress on the ones that don't feel like progress has been made, or an opportunity then to say, here's what's really important to the counties as we move forward on that particular item.
I think having a little bit of insight about how all of this is going to be operationalized might.
So Sarah, actually, Spencer's taking notes over there. Spencer, if you can make a note for us, our next quarterly meeting, we will include a 235 progress update on the recommendation, year one recommendations. And then to Katie's point and Heather, starting to think about operationalizing what's in the request. I mean, because it's a request right now, you know, as well as I do, it could all go away tomorrow. So let's not get too much cart ahead of the horse. I think next calendar quarter, early in the year, we'll have a good sense of what the support is from the General Assembly on this. And then that way we can start to talk about, okay, what does this mean in practice, not just in concept?
And I think part of our budget, not incorporating explicitly the things that we can move forward on 235, it's also important to me for us to be digging in and figuring out how do we accomplish those things though without the dedicated budget resources in a tight budget year. That can't be our excuse to say we're not moving these items forward that we know will be beneficial. It's more of how do we get to yes? What are the things that we are able to achieve? And what is the path forward? So I think it's a really appropriate for us to spend some time on at that next quarterly meeting. And in the meantime, also be talking about, but a deep dive at that meeting.
Perfect. Well, we have start of an agenda for our next quarterly meeting. Any other questions on?
Josh, I had to walk out for a minute. Did we have a little work group to start getting through and understanding their models of staffing, which I imagine are not exactly the same across 64 counties or 59 sites. We have a work team to start.
Well, I think that's up to Heather and Katie, your feedback and all of the director feedback. When do you want us to start to do that deep dive? Do you want us to start that work group early next year when we have a good sense of where the budget is? Or do you want to start to ask for folks now? I think Heather, I just need a sense from you of what as CHSDA and the directors as a whole want to pursue in terms of that work group to get us to the yes that Director Bimsteffer talked about on that particular piece of it.
Oh man, I don't know if I feel comfortable right. Like this is the direction we want to go.
So maybe you just get back to me.
Yeah. I think that would be fine for us to just do a easy follow-up item around the timing. As we all know, there's no good timing after the budget came out. It's really hard to fit it all in. So we'll just talk about those considerations.
So Spencer, if we can get an action item for CHSDA to have that check-in. And then I think the other agenda item is like a pulse check early next quarter on where is the budget requests at all, right? Have some pieces been stripped or everybody's supportive as a whole or whatever that looks like.
Yeah, I would say you want to orchestrate that. What are the talking points that some of you have lobbyists, some of you don't, right? So the associations have some lobbyists, some of the counties have lobbyists. So I think we've really, I'd say, Josh on our team, Rachel is over our legislative. How do we create shared talking points and have an orchestrated plan? We got to get to that X. That is the treasury. That is the treasure, right? And how do we get to X together and get it passed, right? So why don't we just make sure that one of the takeaways is who's on point, what does that team look like, and how do we divide and conquer?
We got it. On the messaging alignment on the budget request. So we're all going to have to speak unified voice to say these are resources that are critical to our state county system.
And I don't think you're just lobbying the legislature. I think you are holding your partners accountable and pretty tough on you to say, I need this funding and I need you to be on this side and see whether we can, there aren't a lot of associations that do the lobbying. They're weighted. So it's the FQHCs, it's CHA, it's the CDHC that have been the most vocal. And those of you that have been in meetings that are on the PHE Unwind, those are the ones that have been in the rooms with us. So I would suggest you spend some time with the advocates, right? Make sure they're on your side. That again, there's not enough money and we've got to pick and choose our priorities. And we've made it very clear what ours is. I don't think you'll have problems with the advocates. Right? The advocates know that you all need the funding, right? So, but I think we've got to ask people to get behind this.
So on the messaging alignment, we did produce that 2-page fact sheet. It wasn't a one-pager. A lot of content to fit into one page. But Rachel, is there anything else you want to talk about on the messaging alignment for budgets?
Yeah, so a couple things. We have our key talking points in the pager. I think leveraging those with your own, and we'll talk about messaging of the strengths of the county administered system later today in our conversation. But if you could put your individual perspective on it when you're talking to your elected officials, that's super helpful. So, you can take the high level and then localize it. And we do have, or we just published our county by county fact sheets with Medicaid funding and CHIP funding in each county. So we just refreshed those. We can certainly use those as well. And that is, I think, what I would recommend is just making sure that we're coordinated there. And Josh, I'd like to be part of whatever the kickoff is for the next steps on budget.
Okay. Spencer, can you make an action item for us to send out the updated county fact sheets? Because I know we've been waiting for those.
And I just want to say to the directors, thank you for the budget requests and making this such a priority and coming through on that commitment that you've been making. I think for the directors and for the commissioners as well, we're still just trying to understand it and wrap our heads around it. And we have it. I think the directors have spent an hour and a half talking through it. So appreciate this time to kind of learn more and figure it out and continue to wrap our heads around it. That's just kind of where we're at in our process.
Awesome.
Thank you.
We had months to think about that.
Great.
You all have maybe a week and in that a couple hours. So, and to that point, I know we got an invitation from Metro directors to join a call if because they wanted more information on budget. If there's any other regions that want us to do that, happy to do so. Or if you think that our time is best spent at CCI and we have a budget conversation scheduled for that, we could do that as well. So,
Josh, team, I have to excuse myself. My apologies. I'll be back a little bit after 1 o'clock. I have to go over a conference and spend some time with the governor on an important issue as well. But I'll be back a little bit after 1. I'm looking forward to seeing you then. Thank you.
actually, it is now time for us to transition just 10 minutes past our time to Heather and Megan for the CHSDA, as Megan's getting talking, the CHSDA structure and the strategic visioning, you guys.
Yeah, I don't think we'll take the full 30 minutes for this, so hopefully we'll get some time back. Thank you. So this language on the slide is hot off the press. We just started strategic planning a new way in October. Start is the key word. We are not done strategic planning, and imagine that that's going to be over the course of the next year. Progress. So we have updated our About CHSDA statement, our vision, and our mission. Exec is currently voting on this, so it's looking like it's getting approved, but just know this is not our officially approved just yet. I just wanted to give you all a sense of how we've updated the language here. And then if you go to the next slide, Sarah, for me. So we have also updated our statements about how CHSDA actually accomplishes our mission. This is really the bread and butter of our everyday work for the association. All of these 8 statements really fall into either what we do on the internal side to support directors through membership resources, education, and engagement, or what we do externally on the policy side and the work with you all to move the system forward. So I think you can see how that falls internal and external in all of these statements. And next slide, Sarah. I know everyone hopefully is aware of our executive committee membership by now, but oftentimes it's just helpful to talk about how we have elected officials that if we have any changes, it happens at the summer conference. So usually around the June timeframe for the elected officials. And then also in our executive committee, we always have representatives from all of the 6 CHSDA regions. And this is so critical for how CHSDA is structured and how we operate with taking feedback to the regions, bringing feedback back to exec as the official governing body to vote and make decisions. So it's just really, really important. Exec also in our bylaws, we make sure we have at least 2 representatives from large, medium, and small counties. And we always have the director from the largest county as a permanent seat on exec. So it's just how we have been very intentional about making sure exec committee is an equitable framework and how we collect feedback from all 64 counties. Next slide. So as I mentioned, the regions are so critical to how we do our work. This is also, as you all know, where your county liaisons go at the state level every month. And it's so important for county liaisons to really be picking up the threads across the different regions and then taking that. And if you go to Southeast after Metro and you're like, this was a big conversation at Metro, I want to make sure we're also sharing with you the responses we gave back to Metro and kind of have that as an ongoing process. It's really, really helpful. It's also where county liaisons can flag big things that are percolating up to be addressed at the Wednesday 8 a.m. calls or any of the other HCPF or CDHS forums we have with county directors. But again, I just really want to stress too that the regions and specifically how we have regional reps on exec, that's really our feedback loop. You'll see that in a couple of slides how many committees just for eligibility and economic security we have. And if it's a important voting group with executive leadership on it, we always try to make sure there's a regional rep so that that voting member goes to their region with feedback and informs that for their vote. Next slide. This is basically just a visual. It's very old, but it is our subcommittee structure with the sub-PACs and the PAC. I just wanted to highlight here that you can start seeing the way we rely on certain county representative experts in how we do our work with state agencies. So for economic security, for our subcommittee and for sub-PAC, as you all know, Jamie is the chair. And then Megan is our county tri-chair of PAC. Next slide. And then, so just for examples, this is really the why you often hear CHSDA saying, can we have Megan, Jamie, and Katie in the room together? Because for economic security and eligibility work, we really rely on Megan, Jamie, and Katie to be the consistent thread through the Directors Association on these topics. So they're the ones that every month bring items to exec that we talk about. They're the ones that go back out to CBMS Executive Steering Committee, take it to Economic Security Subcommittee. And so that I just wanted to make sure that also is like level setting around the why we often rely on the same county experts to be in some of our smaller conversations with you all. Then, as I mentioned there, I did count up when PAC did a list of all of the economic security work groups and task forces across CDHS and HCPF. There's over 50 of them that we either appoint or have county reps on. So it's to manage that consistent feedback loop and the communication there. One last thing. Legislatively, as you all know, CDHSDA does not lobby. We really work very closely with CCI and occasionally with CCAT through the commissioners. That's why we always submit our budget letter first to CCI and then CCI submits it to the state. We are very active on legislation, however, through CHSDA in terms of really doing that policy analysis side of all the bills. And we provide that analysis to commissioners when they're looking at making bill recommendations. County folks, did I miss anything that you think is really critical to elevate about our structure?
Oh, and so for strategic planning, we have started talking about prioritizing a few key strategies to really support our work. It's very interesting in that those two key strategies right now we're looking at are more internally facing around optimizing some of our processes to increase CHSDA capacity. Because as you know, it's me and we have Emily and we don't even have our third FTE, and we work across all state departments and the counties manage every single human service program. So it is a lot to pour into for us. And then we're also looking at really refining some of the resources we have for the member resource side to for that education and engagement for directors. But I imagine as we get down that line further, we would love to have more conversations with state staff about some of the way we do our communication and feedback loops. So a lot of times different state agency staff rely on CHSDA in a different way, whereas we could tell you recommendations for really what would streamline things much better and save us a lot of time, and also make sure you're hitting all directors so that directors can rely on one consistent way of getting some communications. But I think there's a lot more to come on that side of the conversation. Just wanted to give you a quick preview of where we've been so far.
And then real quick on that, I think on the communication side, you and I have had some long conversations about communications, and one of my biggest things was, well, HCPF really needs resources, but I can't talk about that right now. Well, now I can talk about it in that I think as the budget progresses and those resources for HCPF continue, I think it is time for us to have a conversation of how should HCPF structure those resources to get counties the communications they need in the venues and forums and methods that you guys think works best for you. So what I don't want to do is have a new resource and say, okay, this is how we do it, and it doesn't meet your guys' needs. So it might be a separate conversation we need to have as we think about what those resources could look like. If you want us to do it like CDHS, we can do that. Or if there's something that we need to meet in the middle, CDHS needs to adjust, we need to adjust. I think we just need to have those, we need to find a time and place for those conversations.
Right, yeah.
Next slide. Oh, yes, Michelle.
Can I just add one thing? Well, congrats on your new job, by the way. I love all the interactions you have. We don't meet ever. I don't think I've ever met with anyone from CDHSA. And I'm like,
come to executive.
but I feel out of it. So maybe we can add a ongoing coffee and we can do it at Megan's.
Yeah, you're both there.
That would be great. Probably mostly for my benefit to know where you're thinking, because there are so many meetings going on and I don't get the threads of all of them. I get some, but not at the level we probably should have, considering the tight budget years we're going into. We need to like embrace each other.
And Heather and Megan, I know in the past we've had CHSDA check-ins with Director Bimsteffer. I don't think those have happened recently, but if we want to revisit those, then we certainly could. And maybe it might be Kim and Michelle can have simultaneous.
Are you barging into my coffee?
I'm not, but maybe Kim is. But
here. Yeah, of course we could do that. Of course. Of course.
Whatever it is though, like, you know, we don't want, I guess one of the biggest things out of 235 is if when CDHS and HCPF do things differently, that's an impact to you all. So if whatever this looks like, we're happy to meet you halfway. Ian, or I'm not sure who went. We'll go Tiffany and then Ian.
Yeah, me first, Ian. It's also important that we include CVMS in those types of regular check-ins. The communication is key for whether it's notification, whether it's just knowing what you guys are doing and working through what we're doing in CVMS strategy-wise or anything else, communication. So we need to make sure that we keep communication going, CVMS with everybody, because it's a tool that's used by all the different pieces and parts. So just something to add to the coffees. I like coffee too.
You do. Megan and I do meet monthly with most of the office directors.
Yeah, which is great.
CDHS and HCPF too, but would love to also get on the calendar with you, Michelle, and with Kim, and figure out better coordination with CMS communication loop and OIT as well.
Oh, Ian, yes, sorry.
Just for my understanding, so when we're looking at the way that you have your leadership and everything broken out, how does it work for us to know what the official CHSDA position is on something, right? Because oftentimes we're in these different
Good
forums
question.
and there's county representation, but does that look the same as what CHSDA representation would look like in those things? And how are we on the state side sort of able to suss through like, all right, this is CHSDA's official position. This might be a subsection of specific counties who have an area of concern, issue, or priority that they want. I think for my understanding, it's sometimes hard to figure out like when that feedback is coming in, just who that exactly represents.
And directors, please chime in. I would start off by saying it just depends because the formal structure looks very different depending on where you're soliciting that feedback. If it is rising to the level of something we're discussing at exec, that's really where our communication would be like something through CHSDA. Also, if it's a formal body, like an allocation committee that has regional reps that are voting on things, that also would be something that moves through the CHSDA structure. Sometimes we vote as exec on specific things like the moving forward with the federal SNAP pilot.
The study.
Yeah, that was a formal position that we came together and really talked about across the board. And, it wasn't an easy unanimous thing. So we had to have a lot of internal conversations on our side about that and then express those to the state. So I definitely reach out, Ian, anytime there's something that comes up and you're like, but is this an official CHSDA position or has there been a vote on this? Who has weighed in? Like happy to help kind of walk through that whenever those situations arise. And it's so different, especially across the 4 different state agencies and all of the work groups and task forces. But
Is there a standing agenda for exec? I can't remember, or does it pretty much rotate depending on kind of what the topic of the month is?
We always have an exec prep meeting monthly. There are no sometimes we have standing items that might just be eligibility, because that has been taking up half of our meeting the last several months or last year. Then there are some things we try to always make sure we're hitting bi-monthly, if not monthly. But I think with our exec prep group, it's always trying to balance how we do those 3.5 hours because they're jam-packed. We have no breaks, and it's after a 2-hour legislative committee meeting in the morning.
Just one last clarifying question. Is there an opportunity for state staff to work with CHSDA, specifically if, let's say there's an item where CHSDA has taken an official position, they're like, yep, this is what we want to do, we're on board with it, but then we potentially have outlier members of your organization that aren't doing the thing that we all agreed to. Like, how can we leverage CHSDA to say like, hey, we've got to do a thing. Everybody came to the table and said, yep, this is what we're doing, but we've got a handful of outliers who are either not actively participating or, going with whatever agreement we worked on. Like, how could that work?
Yeah, I think use us, reach out to us. I think those regional reps can be a good ally in those conversations on if there's someone in that region who disagrees. I think the regional rep could have that conversation around, hey, I know you disagree, but we as an association decided to go this way. Can we figure out a way that you feel like you can still express your opinion without undermining maybe what the association's doing? And to your earlier question too, Ian, I think in any kind of setting, you can always clarify, like, are you speaking for Eagle County right now? Are you speaking as president of the association? And I think that's a fair question to ask because we are going to sometimes be speaking for our counties and at the big one, at the opinion of our commissioners or whatever it is. So it's a tricky balance, but I think
Totally get it.
use us, reach out to us, and see if there's something missing in our communication channels as well. I think in our strategic planning session, we identified our regional representation and our regional meetings as being one of our biggest assets and strengths, and also one of the opportunities we have to really double down on communication and strengthening, because that's how we can engage everyone. Because you're going to not see a lot of our small county directors at these types of meetings, but they're going to be in those regional regional meetings every time. So, so it really is a strength. So we can continue to learn and leverage that.
Okay. Real quick to actually Tiffany's point on making sure CBMS is included. I don't know that in the regional meetings that we have anybody who represents the CBMS team in any of those conversations. I think sometimes it might be OES and HCPF trying to tag team the CBMS stuff, or back when it was OIT, we tried to pull an OIT. Like that might be, Tiffany, an opportunity for us to, on the CBMS side, to communicate more thoroughly within the existing structure, because we're all there, but I think somebody from the CBMS team might be valuable in those conversations.
Absolutely, absolutely.
Great Zoom question. Ah, she get the big gold star today.
Your coffee?
No, I'm gonna have more. I just appreciate you doing that.
Heather, I think we had a couple slides left.
I think we're done.
Well, my thing isn't working anymore. Strategic plan. You guys wanted to give us the verbal briefing.
I did. I'm gonna talk about those internal things and what we're looking at there for trying to dive into action planning on the member resource, education and engagement side.
Did you need anything from either of the state agencies for your strategic planning?
We'll let you know. I think those conversations are coming. We're continuing to strategic plans. So our next conversation is actually going to be one of our conference sessions at CCI. And as we really get into the meat of action planning around our top strategies, I think that's when we'll probably be reaching out more to state staff about some of that future direction.
Anything else from CHSDA or any of our directors or other folks on the line?
Go ahead, Merva.
I was just gonna say thank you. It's nice to actually have it visually. Sometimes I just, it just helps to be, and so now I'm like, ooh, I'm gonna save this slide deck because this is what I'm gonna reference every time. I'm like, oh wait, let me connect. Yeah.
And also thank you for going through this. It was a good, helpful reminder. But I also say, and I say it every meeting, but I'm gonna say it again, it would be great. I know you guys have a lot of budget thoughts and feelings, as does CCI, and we will start working on our budget in March. So maybe it's in these meetings we're doing, but to get a letter of budget priorities, that's not helpful for us. So if there's any way you can all move your thinking to align with the timeline of the state, I hate to go into budget meetings and say, we think this is what counties want, but we don't know because we haven't heard from them yet. So we'd really love to be more proactive with you guys on that process, especially now that it's going to be really hard budget years and a new administration where we don't know what could happen. More meetings. Coffee.
I think we have to have exec talk about that because we've been a little off our cadence, but totally agree. I think this past year, we really tried to do some draft priorities unofficially for you all around the time frame you were looking at things. And then we did do our budget letter, in the fall because we had all of that updated data and we saw what the allocations were. And that's also really important to diving into the budget priorities as well. So we might try to take a two-tiered approach and just clean that up more. So we'll be in close communication about it.
Thank you. Appreciate it.
On that note, I know in the county budget priority letter for at least eligibility, it was county admin and CBMS improvements. So yay! We have With that being said, I don't know. I was going to call you Laura. I don't even know Laura.
That's a fun, but that's okay.
Sarah will tell us all about lunch, and we are exactly on time for lunch.
We are down to the minute. So we have the lunch here. There's coffee, hot water, beverages. And then on the left-hand side, there are individual box lunches. So what they are is kind of on the sticker on top. So the veggie options are off to the left. And then we have some turkey and ham options off to the right.
And to our folks on the line, we're going to go ahead and go on a lunch break. So you're going to see us probably, I don't know how to turn off this camera. So you'll probably see us. We're not going to mess with the camera because that'll be disastrous. But we're going to go on lunch. We'll be reconvening in 30 minutes at 12:15. So, all right, everybody go ahead and get your lunch.
Hey.
Yeah. That's collaboration right there.
Living real world example of collaboration in real.
Gosh, we're all on it. Good.
And now that I've laughed, I'm like, okay, better make sure I All right, we are going to go ahead and get started. Thank you all for grabbing lunch, and you continue eating. We're going to get into our next section of the agenda, which we will have Tiffany and Nicole with the CBMS team provide some updates around their strategy and vision work, governance charter update, and then some conversation around the service desk. So I will turn it over to Tiffany and Nicole and let y'all decide who wants to lead.
So I'll go first. As we been around the introductions, my name is Tiffany Bryant. I'm the CBMS product director. So thank you for allowing us to have a few moments on today's agenda to talk a little bit about CBMS. We've already talked a lot about it. CBMS is a highly talked about.
There's no such thing as too much CBMS.
Oh, of course. So we'll just jump in with a few updates on some of the things that we're working on. And again, we'll have more slides and updates at our next, maybe we'll get an opportunity to be on the agenda for the next quarterly meeting as well. So we'll have more slides and things about some of the things that I'm talking about today. But today we'll just start with a brief overview of some of the work that we've been doing. I'll start off with the strategic and strategy and vision updates, and I'll kick it to Nicole to talk about some of the governance work we're doing and some of the continuous improvements we're doing around the help desk, the service desk as well. Then Ms. Ghana will help us with some of the SNAP timeliness things that we're working on. And then, of course, our favorite subject is CBMS performance concerns as well. So we'll talk about that at the end, save the best. So just a little bit of backstory on our strategic strategy and vision work that we've been doing. We started off back last year working with the vendor, Public Knowledge is the name of that vendor. We engaged them to partner with us to go through, we envisioned their work to be more of the engagement piece of the strategy and vision. So they worked with us. We went through a couple months of planning. We also, they engaged with our executive leadership. We had one-on-one on-site session. I think it was one session, maybe two sessions with our executive directors to get their input and their vision for CBMS into the future. The next thing we did was we sent out surveys to the users. So some of you may have participated in some of those surveys back in the day, back in 2023. We asked questions. We wanted to engage our stakeholders, our users to figure out what's their vision for CBMS, what's some of the issues that they're encountering we need to include in our roadmap for CBMS as we move forward. And the third step with PK, they met with some of our what we call a cross-agency, cross-functional team. We had county members there. Some of you all may have participated in those sessions as well. We had program area there. We had leadership there. Many different functional agencies, groups that engaged with us at those sessions. Again, they were on site. They were facilitated by our vendors. And again, we were able to engage with our another segment of our stakeholders to provide input on vision for CBMS as we move forward. So they were able to gather that information, do all that research, and put together some pillars for us. We're not ready to, they're in draft state right now. We're not quite ready to share those because they haven't been vetted by the leadership team as well. And then recently we engaged with CDS, which is Colorado Digital Services, which is out of the governor's office. And they were originally engaged to do work with SNAP timeliness and how CBMS impacts SNAP timeliness. But out of that, we gathered a lot of user experience to add to our roadmap as well. They went out to the counties, visited sites, spoke with the users there, the directors there, and other people from county sites to gather what is the actual user experience for CDMS. And Snap Timeliness was the vehicle that they used to do that. So at this point, we have lots of research. We have research from PK from the engagement side. We have research from CDS on the user experience side. So what I'm doing right now is trying to compile all that information together. So we're looking for areas of alignment. We're looking for common themes, common issues, concerns from all of our stakeholders, since now we have engagement information from many different factors. And I'm working to gather all that information into a report that we can use as our guideline to figure out what our future is for CDMS over the next 3 to 5 years. So that process is underway. I expect to have a draft reviewed by the initial round of reviewers by end of November into December, maybe the second week in December at the latest. And all of that is in preparation for what we did with PK. So like I mentioned before, with PK, we had on-site sessions. We had cross-functional teams. We had discussions regarding visions for the future for CDMS. So some of that information now we have gathered. So we have some goals from those original sessions. We have some tactics on how to achieve those goals. Now we need to take those goals, expand on them, and prioritize them, and figure out what are some of the tactics that we can use as a team to get where we to get to the goals of where we want CDMS to be in the future. So I envision having some of those on-site facilitated sessions like we did with PK around the first of the year, where we get these teams together. The plan is not to use the same teams as a whole, right? So we plan to introduce the teams that we had before, see if there's anything missing, see if there's any groups missing, any stakeholders that are missing from that conversation, and add those. Do we have people that have left? Do we have people that we want to add to give all the stakeholders like CHSCA? Do we have someone representing there that we may want to change up or something, just to validate the users that we have on those teams so that we can, again, get into rooms like this, start talking about the goals that we've already established from the previous teams, prioritize those, and figure out how we can work together to achieve those goals. So that's definitely our next steps. And my goal is to start having those sessions in January after we have a reviewed version of our strategy vision. And we've already started on a draft of the roadmap. How do we get there? What things can we do? And we've started, the roadmap that we have right now starts with how do we build the foundation of the CDMS team so that we can support whatever we put together as far as future plans for CDMS as a whole. Michelle talked about some of those items, centralized teams, centralized reporting, centralized location maybe, or whatever we need to do to centralize that team, create the roles and responsibilities that we need to have in place to support whatever we do in the future for CDMS. So those are the ones that we'll be working on. And some of those items are actually in place now. So some of the things that we've done is the realignment. So we've finally signed an agreement between all the different agencies, CDHS, HCPF, OIT, who's responsible for what functions as far as CDMS is concerned. That doesn't mean we're not working as a team. What that means is that like HCPF has maybe the lead on user testing or something like that. So we're still working as a team, but we have leads, have people that are specifically assigned to lead those different efforts. So on the back side of the realignment, we've also started conversations about who's specific or what specific roles are responsible so that when counties have questions, you know exactly who to go to, who's responsible for those particular items. So on the backside of the realignment agreement, the RACI is the next step. So some of the things that we're doing to create a foundation that we can build CDMS onto, some of those items are also in the way. So yeah, that's my timeline. So by the end of December, I expect to be in a position where we can start scheduling on-site sessions where we can actually talk about the goals that we've established. We can start putting some some of the plans together on how to get there. How do we get to these goals that we have? Like Kim said in her presentation, this morning, by June of 2025, we have an implemented CMS vision strategy and roadmap of that's our goal as far as that's concerned. Any questions?
I got a clarification.
Yeah.
Thank you, Tiffany. So, one of the things Tiffany said is we're talking about centralization stuff. We don't mean centralization of counties. We mean centralization of the CDMS team. So I got to look at the org chart and it just made my heart drop because there's so many people involved and well-meaning and smart and good, but at a governance level internally, we aren't doing a great job because Kim gets some briefings, I get some briefings, Ralph gets some briefings, Tiffany gets some, and so we don't have a way of managing all these players. So the centralization will be the CBMS team. Some are OIT, some are CDHS, some are HCPF. We aren't going to call them that anymore. They're all the CBMS team. They're going to get t-shirts. I don't care who's paying your bill. I don't care who you're like. It's one. I will get t-shirts. Black Friday's coming up, so I can get them for $1 each. But the idea is like that is fundamentally in the way of us doing a better job with CBMS. So the centralization is it's one CBMS team. The CBMS team is under Nina, who I mentioned earlier. It is not how we're doing it today. So massive change management to come. But as part of that, we're going to have one stop shop on CBMS. That makes sense.
Absolutely.
Just wanted to clarify that. And yes, and we're making all your CBMS staff work for us. Okay. I'm saying no to the people on the phone. That's a joke.
Any other questions regarding some of the plans for this? We definitely, one of our goals is to make sure that we continue to involve our counties, our partners, whoever our stakeholders are in the whole process from start to finish, to build out those goals, to prioritize, to figure out how we together get to those goals. So that's our plan. And I hope to have a presentation at our next quarterly review as well, with more details included in that. All right, so I'll pop it to Nicole. One of the other focus items, did you have a question, Michelle? Okay, one of the other focus items that we're looking at for CBMS is continuous improvement. How can we improve processes? How can we improve the user experience? All of those things. So Nicole's going to talk to us about some of the things that we have in play, not all, just some that we have in play for continuous improvement as well.
Good afternoon, everyone. For those of you who may have come in after my introduction this morning, my name is Nicole Duran-Jones, and I am the Deputy CBMS Product Director, so I am Tiffany's deputy. And can I get a sweater? I'm cold all the time. I want a sweater. I'm super excited to be a part of the CBMS because I've had a long history, a long relationship with CBMS. So I feel for the county folks because I was one of them. So the governance structure is a piece that we've been looking at for the last few months to update to intentionally bring in our county partners into the governance processes. And so when we talk about continuous improvement, this is one of them that we started looking at through the after the realignment. The realignment started like April of 2023, right? So we took that as an opportunity to take these processes that had been started with OIT and taking a look at how they're working in their current state, but then also revitalizing them to ensure that we're intentionally engaging our county partners. So the first thing that we did is really taking a look at the charters. We're about 75% done with this work. I say 75% because we've had all of the meetings with our subject matter experts. So some of the folks who are representatives of like the executive steering committee, work plan subcommittee, user IPT, or it's the peak users group now, and now I can't remember what they were before. Client IPT is what they were before, and so they're transitioning to peak users group because they're span is much broader than just clients. We have a few different modules that go into that. So they're transitioning to the peak users group. So apologies for me dropping that name there. So we included the subject matter experts of each of these groups, including our county partners, to pick apart these charters. And what does it look like now? What should it look like? It's 75% done because we've had a lot of feedback, both externally and internally, and they're currently being updated based off of that CME review and peer review feedback, because we need to make sure that they complement each other and that they fit within our business processes as well. So our next steps are that we aim to finalize these drafts in December of 2024 so that we can implement them in January. Our drop dead due date to have these done and updated is June 30th of 2025. So we're trying to align that with the strategy and vision as well. And no, I can leave it there. Any questions, comments, or concerns on the governance charter updates? And knowing that it's in the name of continuous improvement. So there may be processes that we adjust and we take back and we say, is this working? And if not, then let's take a step back and try something different. And so that's what we mean when we say continuous improvement. And then also knowing that transformative governance was a pillar that came out in our conversations with county partners and with our internal stakeholders when we did our those stakeholder engagements that Tiffany was talking about for our strategic vision and planning. And so we want to make sure that we will get to that transformative governance, but right now we want to focus on making those intentional adjustments in our processes to incorporate our counties. I've got for governance charter update.
Okay, I'll jump in and kind of update everybody on what we're doing with SNAP timeliness. I'm Muscana Tesfaye, I'm BITS director, and how I actually fit in here is CBMS is the CDHS CBMS team is part of the BITS division for now. That might change in the future with the head of product, but
that is changing though. Just want to be clear. That's changing December 2nd.
Yeah, so for now. And so I am actually in charge of helping facilitate CDHS-wide technology.
Scanna's working lots of hours.
Yes, indeed. And in that vein, we're working with our OES team to work on SNAP timeliness. And so along with CBMS, there's a few other initiatives that we're working with Abby and Shelley on regarding technology and how we can improve SNAP timeliness. So I'll cover a couple of those threads, and Michelle will get a more detailed briefing on this afternoon. One of the things we've done is we've worked with OIT to move access and identity management from OIT to the CBMS team. That happened, I think, a couple of weeks ago for the full transition. What that'll allow us to do is really have focused identity management staff. So when you onboard county workers, we're not going into an OIT queue with every other state agency and every other application that's out there. The CBMS team will have dedicated folks on their team that will focus on that. We had an escalation from Abby a few weeks ago from one of our counties that we were able to expedite quickly. So that should alleviate, on a long-term basis, the problem of folks getting onboarded and not having access to CBMS for weeks and sometimes months on end. There's a second phase that's going to happen soon. I think it's just more of account maintenance access that we're working with OIT on. So that's done. Rushmore is a system that the OES team has rolled out last week, I think, and that should help with facilitating better communication between CDHS and counties around case management, if I understand that correctly. I'm not very keen on what the tool does, but we helped expedite the rollout.
Yeah, it's for us to do better intensive case reviews of county cases so that we can better assist with identifying root cause issues or processes going on within cases. Yes.
Can we connect on that? I would love to see what you guys are doing in your root cause analysis.
Yeah.
Stuff.
We've had it for 3 days. Might be a short meeting. So I'm taking it out of the box. But I would love to collaborate as we move forward with implementation and see. I think we're still experimenting on how we're going to incorporate it into our ongoing work.
Is that for like QA processes or like your
No.
you? It's just a whole separate.
It's for TA.
All right.
Yeah.
Any other questions on Rushmore? Okay, no worries. Please jump in whenever you hear something. Data. Mike Danzel, our data governance director, who is also in BITS, is working on a dashboard to help us pinpoint system performance issues and tie that to actual county productivity. So the point of all of that, and there's a lot of data elements, a lot of technology and technical stuff that goes into it. But the point really is, what do we prioritize? As Josh said, we only have a certain amount of full hours, only a certain amount of resources to be able to fix all of the problems with CDMS. How do we focus in on the ones that are high impact, low effort? And that's the point of that dashboard. And in order to get to that, rather than trying to figure out what one county wants versus another, you want to use a data-driven approach where that dashboard will help us pinpoint, okay, this issue happened, this very specific issue, and it really drove down county performance. We really need to focus our resources on that. So that's the purpose of that. It's easier said than done. We're trying to get that data out of Deloitte. That data has been received, but it's a very manual process. And we're going to eventually try to automate that so that dashboard is live. It's feeding itself through the system automatically, and then there's no debate as to what the source of truth is and what's going on with the system. So that'll be forthcoming. We have, like I said, we have the data, we're developing the dashboard, and then working with Deloitte. That's going to be some development required to make that automated. And Nicole has been a great resource on that. Tiffany mentioned user-informed innovation. That is our Colorado Digital out to each county, kind of sitting by county workers and identifying what's really, the problem with the interaction between the county worker and CDMS. So that study's been done. I think that report has been put out. We just have to prioritize that development. And then help desk. Nicole touched on that. I won't belabor that point. CBMS work plan, and then Gen AI IVR, which we're waiting on FNS approval. So all of those things are things that we're working on for SNAP timeliness, but that impact CBMS as a whole, and eventually long-term sustain a more functioning system in the long term.
Thank you.
Did I do good?
Yep.
Okay.
Thumbs up.
Question.
Yes, sir.
I missed this this is actually more for you, Andy, and Josh. Really, I missed this while I was contemplating the apple versus Katie's carrot cake. Totally my fault. I missed being part of the conversation. Or you said you just got something related to a root cause 3 days ago, but I was fixated on that.
We got a software that facilitates our ability to do intensive case reviews at the state level, which we're expecting to use to facilitate root cause analysis and better diagnostics when we're working with individual counties to inform the advice and guidance we give about their processes.
Gotcha.
We did get it 3 days ago, so some of those things may change as we actually take it out of the box and take it for a spin and see how we're able to incorporate it into our ongoing work.
Well, thank you for that, and I apologize for not.
No worries.
Time.
The carrot cake was distracting.
Yeah. Well, I ended up with the cookie. I went with the cookie,
Either one.
and then I accused Katie of bringing the carrot cake home. But she then said, no, that was an option as well. In the root discussion.
Well,
How do we have all that figured out?
it actually sounds like we planted that so that you would encourage people to come in person.
Yeah.
Yeah, they're talking about the carrot cake in the chat.
There you go. Great. Anything else you wanted to add before we jump into downtime?
I have a service desk slide here. Are you
Okay.
taking that?
I had a moment where I was like, did I talk about service desk? I forgot about it. Blacked out and talked about it. The service desk update. So we've had a couple conversations during executive steering committee about the service desk and how they support CDMS. And so a little bit of background. So our county partners engaged with Colorado Digital Services and gave a lot of really good feedback around the service desk processes and how that, looking at my notes here.
You're doing great.
Flustered. Thank you, Michelle. Thank you. Looking forward to it. So we got a lot of feedback from the site visits and then also indirectly in some meetings here and there. And some of the things that we heard from our county partners on things that they'd like to see are faster triage of help desk tickets, clear error code language, so clarity on what the error message means, guidance on how to respond to frustrated applicants, or issues with policy, quicker responses from the state, criteria for CMS communications on help desk tickets, and CDHS and HCPF program policy, staff awareness, and engagement. And so based on the feedback, we really believe that a future state process needs to include some really clear process steps, roles and responsibilities, because just in case you all didn't know, but the service desk incorporates 3 different agencies and then also Deloitte. So it's HCPF, CDHS, and OIT, and then Deloitte. And then we also bring in the counties into the prioritization meetings as they're able to attend. And so it's a lot of moving parts. It's a lot of stakeholders to engage. And so we want to make sure that we have clear roles and responsibilities, clear process steps, clear timelines, and a collaborative effort internally and with our county partners to address system defects and to improve the outcomes for our members and clients, for what they need. So the next steps for this is actually we're in the midst of securing a project manager to lead this and project participants to ensure that this important work has the support that it needs. Jessica Olvera, who is the OIT manager of the service desk, she has reached out to get a list of county folks. So CHSD friends, you might be getting that request here soon on who has the bandwidth to attend these conversations. So we're really excited about that. Any questions, concerns, comments on it?
Just appreciation that you guys are willing to do the deep dive.
Yeah, I think it would be really good because we need to look at it all the way through, right? Soup to nuts, especially with that transition of CDMS from OIT, and then also just background information. OIT transitioned to a different tool called Service Hub. So they're also navigating a new technology and we're trying to get better data out of it. Yeah.
Thank you, Nicole. I was just going to ask about Service Hub. So with this process, do we anticipate that maybe we might identify some enhancements needed for Service Hub, and then we can have conversations on how that moves forward? I think that's where I've been a little unclear, given my team that works on from the HIPAA perspective. I'm unclear about what, CBMS, I know where to go to for make changes, but Service Hub has been a little bit more in the black hole for me.
Okay.
So is that something that may come out of this group as well?
I don't see why not. I think that the more clarity that we can get around Service Hub, because I'm gonna be honest, I'm terrible at using stuff. So I usually email OIT for everything I need. You create a ticket for me. So I need to learn too. And I agree. I think that there's pieces of it that can be navigated easier. Jessica said that they did do a stakeholder session and made some improvements based off of that stakeholder session. So I do believe that there is the ability to have flexibility in the way that Service Hub is, that you maneuver through it. And so I think that's a really great and important piece there, because if we're also, because we use it too, right? Anytime we need something through OIT, that's how we engage them. And so I think it's really good feedback, and I don't see why not. So I'll put it on my list. Thank you. Yeah.
I would ask Katie and Jamie this question if they were in the room, but I have the feedback that you guys have gathered using Colorado Digital Services been compiled and sent out more broadly with county directors in any way?
That's a great question, but I can touch base with Colorado Digital Services team and see if they have that on their radar.
Thank you. Yeah, we talk about the help desk and this component and the process quite often in our meetings, but I don't know that I've seen it shared anywhere. So I just want to make sure have that and we can get it out.
Yeah.
Heather, is that something that would be good for in-person engagement too? Like, do we need to have them join the regional directors meeting and brief directors on what's in that, or are you good just the deck?
I don't know what's in it, but I would also ask directors to regional could be a really good model if you guys are interested in diving more into that. But we could have a deck and then we could ask the regions if they want some more focused time.
So I was just going to add, so we do have the report from some CDS. So our first steps were to meet internally with all the different stakeholders that were represented in that report, just to go over and validate the individual steps and the information that's in there, just to make sure that we have an accurate picture before we start distributing that out. So our first meeting was internally with all the different stakeholders, with the HCPF staff, I think we had some counties on that call as well. Let's validate the process as it's been documented to make sure that it's accurate before we send it out and create additional questions. So that's where we are now. We had one meeting. I think we have a follow-up meeting scheduled. Then we'll have what we consider a validated workflow with all the different people that are involved currently. And then we can start sending that out, getting questions, adding engagement so that we can work on opportunities within that process to improve or to answer questions or whatever we need to do from there.
Sure.
I have another just question that maybe to all of us. I'm assuming this help desk initiative is got the pedal to the metal, like we're doing everything we can to fix it right away. Because if I'm getting it right and kind of stuff, this is one of the key things that'll help 95% timeliness. And so is there any way that we can just like make this happen?
Yeah, the biggest thing that we want to make sure that we have in place is a strong project manager that they can lead to this work. So I actually have a meeting tomorrow with the PM that the HCPF EPMO is suggesting, that's the word I was looking for, that I use for this work, because we need someone who's strong in process improvement, and I'll be there to help support and sponsor because I have a lot of experience in process improvement. But I don't have the bandwidth.
So if we have it, we also have a pretty large group of project managers at CDHS under Bridget. So hopefully we can move.
Want to get two of them?
I want the ones.
We talked about their capacity for process improvement at the meeting, the EEMC meeting yesterday. And I definitely made that note to see if they have resources available to support us in this system. Follow up on that.
Next step, guys.
Yeah.
Okay.
So I think we're out of our allotted time, but I do want to close. Did anybody have any other questions from Barry Help Desk? So I want to, I'm not sure what's going on with my voice right now, but I just want to conclude with the outages, the downtime, the performance issues that we've had with CBMS. And I apologize, we didn't leave a lot of time for follow-up and conversations, but I just want to express to all of our directors, all of our teammates here that we are aware, we understand, we know that CBMS is a primary tool for what you all do and for serving our customers. So we are actively and diligently trying to stay on top of reactive monitoring. We've hired staff to enterprise architect. We've hired to make sure that not only all the pieces work, but that all the pieces work together on a continuous basis. So we've also talked to counties about communications to make sure that it's delivering the information in a timely manner and allowing you all to, in the event of a downtime or disruption in service, that you have enough information to figure out what to do with your staff, right? If we know we can't do this, and we can put the staff on this, right? So whatever information that we need to deliver in order to support some of that work, but our primary focus is making sure that we are proactive, we're monitoring, we're right on top of making sure that the system of systems, as we call it, is working to support your day-to-day operational issues. That you're in front of the customers. When the system doesn't work and you're in front of the customers and they're frustrated and you're frustrated, we understand that, and we're doing everything we can to support that that doesn't happen very often, or we can limit and mitigate how that often that happens for sure. So just know that we hear you. We're doing everything we can on the back end to make sure that we support you in what you do so that you can deliver the services to your customers as well. So.
So I know we're in time, so I'm going to make this a really brief question. We don't need to go into detail on this one, but in reviewing the capital construction information technology request that came out in October, there's dates in there regarding the solicitations for the 3 modules. This will be a pretty big deal coming down the road here, whether it's in this administration or straddles into the next one or is fully in the next administration. So I'm also having a little bit of trouble when I track back through some of the presentations from the summer and then what I'm reading in that document on the timeline specifically on those 3 modules. Is there an updated timeline on when those solicitations will be released for each of those 3 modules?
We can definitely take that note back and provide that timeline. I know that there is an updated timeline. I don't have it with me.
Okay.
But we can definitely get that information and make sure that you all have those updated dates as well.
Okay, thank you.
And I know, Kevin.
There is some buffer time built in there because we do have to send our solicitations over to our federal partners. So depending on how quickly we get that back will dictate when we can actually post. So just keep that in mind too, that we're not, moving them back and forth, but there's kind of a buffer date there for us.
Totally understand. And there's, of course, a lot of grace for that. It's more of like, what's the goal? And
What's the goal?
Yep. For each of those 3 modules.
Yeah.
So we can definitely take that note and provide that information.
Thank you.
The quick clarifying question, Kevin. Is it just the dates or is there additional information or context that you or your members think would be important as part of that? Or is it just to kind of have an idea in the back of your brain on when big things might be coming?
Yeah. So, and I'll give my thought on this. The reason I asked the question is there's basically a 5-year window, right, before the contracts have to be inked. That's a really, really long time. And there have been different dates when the deadline was, was it 2029 or was that extended from other dates and things like that? It's really more just the general, like, okay, so for the client correspondence piece, if we could wave that wand today, we're going to put out that ITN on, in 2027, then we'll do this one in 2028, the next one, blah, blah, blah.
Mhm.
Just that general. So for planning purposes, because there's a lot of money in that request that goes to only building out the solicitations and not to actually making system improvements.
Yep.
So, and I'm not here to quibble with the dollars over that today. In the today, I'm not.
Okay.
It's more just that time frame generically.
Thank you for the crystal ball.
And we do have some of those dates, so
Thanks, Tiffany. I appreciate that.
And I do know just from the HCPF perspective, those dates were kind of in flux because of PHE unwind. And for us, it was not a good idea to advance free procurement.
Yeah.
Bring the PHE unwind. We really would have had a house on fire situation. So, anything else on CBMS or for the CBMS team? I really do just want to end from my perspective with a thank you to Tiffany and Nicole and Muscana and the whole CBMS team. It is not an easy place to be in.
Thank you, guys.
With a system not always working the way we want it to, but they are graceful and they accept the feedback. And Lord knows when there's an outage, all of them are like hair on fire, trying to do what they can and like nervous breakdowns almost. So there's still work to be done in CBMS. I just want to thank the CBMS team for everything they do because it's not an easy job they do on behalf of all of us. So thank you, CBMS team.
Thank you. And thank you for your time letting us do updates today.
Count on it for our next quarterly.
Yes, I'm hearing that. And I look forward to meeting with you all as your regional meetings or whatever that is, because I think communication is the key. We need to be right on point when you guys are having issues or when we're seeing themes or things that are going on in the community. So,
and the communication should be collaborative, right?
Absolutely.
Like we're working with CDHS OES team and we're working with HCPF teams and counties to make sure we're not duplicating communications or we're all saying the same thing at the same time. So
absolutely.
Opportunity there. As always, communications are a continuous improvement project in and of themselves. All right. Right, I'm going to transition into our 2025 County Administration Rule Updates. This is for healthcare policy and financing. I'm just going to check with Rachel if you want to add anything before I kick us off on context.
No. But I can. I think this process is really important to us, especially in light of what we've learned on Medicaid over the course of the unwind. We're trying to be responsive to what we've heard in the community as improvements we can make as overseeing the counties and making sure that we have a forum to engage to make the system work better for all of us. So we're starting engagement with you all, and then we will also broaden it this time around to be more inclusive of advocates, of hospitals, and many of the partners that we've been talking with along the way. It will be a little bit more inclusive this time, and I think we'll get a better end product. So with that, I'll hand it back to you. Thank you.
All right, so first I'm going to start with what are these rules even? There are two components to this rule set. The first is our fiscal rules. And the second is our programmatic rules. Our fiscal rules are due for a top to bottom modernization. They were last updated over 12 years ago. Which is sad to say, but it's the reality of the situation. On our programmatic rules, you all sat with us about 3 years ago, and we updated those together. We are just going through the next phase of those updates. So, I'm going to talk about some guiding principles for us. In these rule updates, our first and primary focus was modernizing the fiscal rules. There were things in there that we found that were terribly out of date. So for the fiscal rules, we have actually had a task group that includes county finance officers, and the task group has been looking at those fiscal rules since the summer. So we literally went section by section to talk about what needs to be modernized in those fiscal rules. The other focus in here was streamlining administrative processes. So we know we ask counties for deliverables. It might be a plan on this, or it might be a plan on that. Our intent with this rule update is to standardize our due dates. Like if the state has control over those due dates, we're going to set them so that way they're one due date. Well, actually, it's going to be biannual due dates. So things are going to be submitted twice a year rather than all throughout the year whenever we've decided for things to be submitted. And there are also things that we're asking for now that we're going to stop asking for. That doesn't really, not that it doesn't matter, but we can get the information in another place. A good example is county budgets. We ask counties to submit their budgets to us every year. Well, guess what? Those are posted on DOLA's webpage. So we're going to say, don't worry about giving us your budget. We'll just pull it ourselves. So those kinds of things are all a component of the rule revisions. The two most important things, though, are incorporating the lessons learned from the PHE unwind. One big lesson learned was when the PHE happened that month. I went to counties and I asked, can I have your continuity of operations plan? Essential for any business operation. About half of counties didn't have a COOP plan. So we're going to have to work to address that because there should always be a document that governs continuity of operations. And then most importantly, addressing community feedback, including those challenges reported by members, advocates, and providers. So when you all take a look at these rules, there shouldn't be much that's a surprise in here, but we're going to talk about how you can engage in the process. So we have actually started our county fiscal rule committee. That was late summer, early fall. Those folks have been meeting. Our first big date here is December 10th. So our regular HCPF monthly director call has been co-opted, and we are spending the entirety of the 2 hours going basically section by section on what is changing in the programmatic and the fiscal rules. On December 10th, counties will also receive a red line version of those updated rules. And from there, it's basically a month where you have the opportunity to look at the rules yourself. We will have a formal written comment tracker. So you want to start to provide written comments, all of that, understanding that the holidays are occurring and that sort of thing. We didn't want to rush that. So basically, about a month to review on your own time. However, Starting in January, we will then kick off a series of bi-weekly meetings with directors around programmatic rule updates and fiscal rule updates. Those will go from January to March. We will wrap up those sort of engagements at the end of March, early April. We are aiming for rulemaking at the end of April for these rules to be effective July 1st, 2025, along with the HCPF budget request. So they all tie together. Opportunities. So I kind of just went through this with the visual. On that 10th, you'll receive that red line. Feel free to start to add your comments, review with your teams, that sort of thing. January, we'll have those bi-weekly check-ins where when I say on the December 10th meeting, we're going to go at a high level, section by section. This is what changed. In the bi-weekly meeting starting in January, we're literally going to go line by line in the rooms. And it's going to be a little bit tedious, but I think it's important for us to make sure we're all on the same page. Our public comment period will go until early April, and then there's a public comment attached to the rulemaking hearing. And at which, of course, you all are invited to the public hearing on the rulemaking. I did want to note, although Rachel said it, that the folks that you all have been participating in weekly, now monthly calls with, they're very interested in these rule updates. So we are going to do a series of stakeholder engagements with the advocate community and a series of stakeholder engagements with the hospitals and the provider community, at which I think it would be a great idea for you all to be a part of that if you have the capacity to join. I think it would be best if you all hear that feedback directly and what they think needs to be improved in the system. From there, I think that's actually it. Just wanted to give you guys the timeline. And so I'll go ahead and go to question from Mary, and then we can check on chat.
Yep. Thank you, Josh. And I appreciate the engagement with counties to go over the rules. I also just want to point out the start of this at the same time we just received our priority work focus, which was to complete the work tasks. And now we have this rolling out with the other workload stuff. So just kind of asking for some grace and mindfulness maybe of the timeframes and when this should start.
The timeframe for when it started is directly tied to the effective date of the rule. And HCPF's priority is to align the rule updates with the budget request, having an effective date at the same time. And that being said, we can work with scheduling, we can work all around that. Like, that is not yet set. So whatever it is you guys think is best in order to manage that task, plus what this is, we're open to hearing that, although Danielle's raising her hand, maybe she can see it.
Not everyone is going to want to sit in a rule meeting and go line by line and really get these rules wordsmith. Because if I didn't have to, I certainly don't think I would be. But that's the purpose of the written comments, is that as you guys have time, or as, let's say, your city or your county attorneys are looking at these rules, they can submit comments, and that's another way to engage. So there are multiple ways for you guys to engage. It does not have to be in those bi-weekly meetings.
Yep.
No, I appreciate it. I think it's just the time commitment to review and understand all of the rule changes in conjunction with the timing for the other priorities. And so just kind of pointing that out. But whether or not we participate in a meeting, it takes time to go through all of that and provide feedback, comments, and have the dialogue. And
so I'll go to Rachel and then Heather.
And there's somebody on the line. So on that, Mary, I wonder if it'd be helpful to record some of the what's changing, so then folks could tune in when you can, right? We know you all have a lot on your plates, especially given the, this time of year. So let us know what would be most helpful there, because sitting in a meeting isn't necessarily going to get to that base to everyone. So we can explore some different kind of, here's the base of what the red line means. And then have the conversations too, because we want to allow those opportunities for folks to dive in if they want.
How big is the rule?
Yeah.
And when is the last time that this was updated?
So the fiscal ones were updated before I managed the county team. So it's been a long time.
12 years.
But yes,
more.
Those are, and a lot of those changes are fairly technical in their grossly outdated, some terminology, et cetera. But the other rules were more recently updated, what, 3 years ago, Josh? So they had a big modernization at that point. What we're looking at now is, okay, we did the modernization, we did that big lift. Now where do we go to actually make, remove some of what we had in the rule as requirements that we could get other places? How do we streamline, our piece of it to make it less burdensome, one, and two, how are we being responsive given this once in a hopefully lifetime pandemic experience and unwind that we had? How do we leverage what we learned there to improve?
And how big is it?
And you know the numbers.
The existing rule set now, I think, is something in 50 pages for both of them. And just to be clear, it's not eligibility determination rule.
No, it's administration. Yeah.
So when Senate Bill 235 talked about aligning administrative requirements and stuff, that's where for HCPF, all of those things live. Which is why they're all tied together with the budget request. Other questions on this county admin rule outreach plan? And just to co-opt the question preemptively, we are working with CDHS and they do know what's going in those rules. We're actively talking about collaboration and coordination. So, we're not trying to do this in a silo. Anything else before I turn it over to Rachel Megan?
And I understand you've been collecting feedback from the ME review process. Are you internally incorporating that feedback into these rule changes?
I would say the ME review feedback probably is not particular to these rules, because in the rule, there's literally like only a couple sentences on it. On ME review, that's more outside of the rule. But we are collecting that.
It's the administration of the program, and that's what ME reviews look at.
So the administrative rules talk about ME review being required, but they do not talk about how that looks. And it's not going to talk about how it looks. That's not what the revisions do.
I'm just thinking if there are things that have come up during the ME reviews that have been administrative findings or problems or consistent issues, not specific to the ME process, but to the administration of the program that you've come across through the ME review process. And maybe that hasn't been gathered in such a way to feed back into the administrative roles.
We do, but I guess we're kind of looking at them in parallel, because like one of the biggest findings on the administrative side is protection of PHI, right? And so the rules dictate what PHI protection should look like, but really one of the biggest finding is counties aren't protecting that data. And so we're just asking for a policy or process to be put in place to protect. Right? So from that perspective, it's not, we wouldn't add any rule around that because the rule's already there. But one thing that Eric and I talked about was at the January HCPF director call, he is going to go through a presentation with directors on everything that we're going to be updating for this coming cycle based on the feedback we had received in this previous cycle. Remember, there were things that we had changed and updated mid-year this year, but there were things that we said, that's a great idea, but that has to start in the next cycle. And the next cycle would be 2020.
Clarify what you said about counties are not protecting data.
Yeah, so one of the biggest findings in ME review is that PHI is not being protected. So counties aren't, it's not everybody, it depends on the county, right? But there are counties that have not encrypted emails in the past. There's counties that did not have the procedures in place to report a breach, like all of those kinds of things.
Okay.
Yeah. Which, as HIPAA covered entities in and of themselves, counties are subject to that, right? It's just HIPAA from the Medicaid perspective saying, are you protecting the Medicaid data? That's one of the most frequent findings on the admin side is the PHI stuff. Any other questions? Rachel, you had your hand up.
Can we have discussion though, before Eric presents in January, what you're gonna update? Is there opportunity to like talk about it beforehand? Or preview it with directors, so it's not just, we come in, we get the information, it's done and.
Well, I mean, we certainly can, but the changes are based on your guys' feedback in the first place. So, like, one thing was, we asked for a policy around a certain eligibility thing, right? And one of the things you guys said was that's burdensome. So, okay, we're maybe won't ask for the policy, but we're going to ask for the communication plan of how you're going to train your staff to make sure that they're doing that thing. So that was like a change that we made based on your feedback. All the changes that are going to be made are based on your guys' feedback. So, I mean, yeah, we can.
Collected in a formal way, like, do you guys have a survey after you do ME reviews, or how is that?
Yep, that was another change that you guys asked for that we did, that after every ME review, there's a survey that's sent. It's sent after the review, but before the findings are issued of how the process went and what needs to be improved. Megan?
And I understand why you do the timing of it that way, but I think the survey should come at the end of the entire process, because the visit, I had a very different opinion of the visit than when I actually got the feedback, because I was not given direct feedback by the people while they were doing their ME review on site, and then got very direct feedback. So it's almost like the team was knowing the survey was going to come out. So we're very friendly and very complimentary during the whole on-site process. And then it was a very different experience after I completed the survey. So I think it would be very helpful to be able to give feedback again after the closeout of the entire process. Not in the midst of it, but I definitely have additional feedback post-survey that I would love to provide to the process.
So you're actually talking about a different process for us, but what I think you're saying is we need a survey for the monitoring phase. So we consider the ME process closed upon issuance of that report. Then we go into
a draft report right now.
uh,
Still in the process of submitting the cures. So I think it's still.
we consider it the ongoing monitoring. But the point you're trying to make is you need to provide feedback about that piece, and we can think about what that should look like.
Right. Well, and it's part of the ME review too, because like you said, you know that these things are consistently found to be discrepancies across the counties. Your team is probably seeing that while they're on site, and they're not saying, this is probably going to be something that we're going to have to call out in our report. They're just breezing past it and going on to the next topic. Whereas it would be really helpful for all the teams on site to say, you know, this is probably going to be a finding. Here are some of the things we'd really like to see in the cure process. Here are some ways that we can address this differently. I'll shout out our friends at Dues, because that's exactly how they did their on-site visit. They said, here are the things that you're going to see in the report. Here's how we would love to see it addressed. If you have any questions, this is how you do it. And it was just a very different experience. It didn't feel collaborative during the review. It felt almost secretive by the time we got the actual report.
Because HCPF's process is we don't issue what the finding is until we've gotten to the end of the stage, and then it's okay, here's what we found.
You know, I mean, the team knows what some of the things are going to be.
Sometimes.
And I just think that it could be a lot more collaborative, and I've experienced it from different teams.
Okay, take that view.
Can I just go back to the rules and getting them a little beforehand so we can look at them? I do, I'm thankful that you all took the feedback from the counties and are making the rule changes based on that. But historically, it's not always been exactly what we were looking for and hoping for. So as much as take our feedback, the rules don't always come back the way that we anticipate them. So I think the more time you can give us to review things, the better. If you're able to, I think it would go a long way.
Welcome back, Kim. We saved you a lunch.
Thank you.
Right, any other questions on rules? Rachel, you're up for federal election update.
Yeah, I'm wondering if we do the messaging first and come back to this. So can be back at the table. So on our last get together where we had lunch, we had an exercise where we talked about the value of the model that we have here in Colorado, which is unique across the country. There are a few states that have our same model. So these slides you all will have afterwards, but I thought it'd be helpful to revisit just, those themes. And I did share these with CHSDA, I think, and you all shared kind of the themes out amongst your channels, but this way you can kind of see them on paper here. So the first slide here is just the strengths of our county administration model broken up into, what we heard from you. These were from your sticky notes, organized into themes. So leveraging local relationships, the local face, you are in the community, you're part of the community. So you will have seen some of this layered inside our 235 report, some of that narrative. So none of this should be new, but I thought it would be helpful just as we move into a potentially challenging budget year and have a budget request out there, just reminding folks of the value of our system. So improving access was another thing, that face-to-face in-person assistance, investing and investing locally, another kind of bucket of the themes that you all brought up, allowing for customized and innovative approaches. Some of that, those regional approaches that you all talked about in your sticky notes, and then the flexibility to manage programs. So I won't go over all the detail, but just wanted to remind us of the work that we did before, and that it just felt good reading that again, like this, the face-to-face interaction, those being in the community and knowing your community. And that's just really, really valuable to build upon. And then we talked about some challenges. What I didn't do was crosswalk all of the challenges to the solutions in our budget request, in the 235 report, in kind of the other solutions, but many of these challenges we talked about, we're actively working on together. And we talked about them here, we're talking about them in other forums. So I just wanted to remind and kind of revisit that we heard you. These are some of your words from your stickies, and we are working on it together. And I think we made a lot of progress, a lot to go, but there are some challenges that we're going to be addressing, hopefully through those CBMS improvements, through the realignment, through the strategic planning, through kind of reorganizing how we're communicating with each other, and many of those 235 recommendations, and of course, the additional funding. So the buckets, there's some general buckets of challenges, and then some, some of the things that we've heard too from advocates are here that we can expect to hear again. But the, like things aren't standardized. Well, we have some solutions we're working on towards that. We, the cost and resources, we're trying to address that through that budget request that we have. The frontline pressures that you all have felt through COVID, really important. We are seeing our members day to day. You're the face of our programs, and those pressures are real, and we want to be supportive of you all and your staff as you go through all of those challenges. Staffing and training were another bucket of challenges we talked about, and we have some solutions in the works, but again, more to do there. And then solutions that we talked through, on this last slide of this section, our budget requests we couldn't talk about publicly at our last meeting, but no, we heard you. We're trying to weave in some of the challenges into the solutions that are part of that budget request. CBMS strategy and vision, JAI, we talked about that till we're blue in the face, modernization. And that improved collaboration is really important. That meeting, this meeting, this series of meetings is part of that. So I just, we're not, I don't want to, go line by line on this, but remember what we did, remember where we're going, and feel free to use any of these themes as you need to in your future discussions about the importance of our model that we have and the importance of moving the budget request forward or other things forward. So with that, I'll pause to see if there are questions related to this section, and then we have our fun federal topic at the end. Feel free to stew on this and we can come back to.
The solution.
We'll go back to the previous topic. Just wanted, and this is in the lines of kind of keeping open lines of communication here. There was a recent election, as you all know, and there are potential program impacts, and we are all committed to having open lines of communication as we know what we know from our new federal partners. So we do anticipate we'll have some action here in the next few weeks from the outgoing administration on some very important priorities from the Medicaid space that we have before our federal partners now. So the next slide is really talking about those policies we currently have with our federal partners for consideration. This is the CMS, so Centers for Medicare and Medicaid Services. We have some important waiver extensions that we have before them. These are not political in any way, but they are sometimes a transition can mean that things take longer as new partners come into play and get in their seats and folks are confirmed. It just can take longer to move things forward. So this first bullet really talks about that, the substance use disorder 1115 waiver that we have. It's an existing waiver. And so we have this in place. And our federal partners asked us to amend that in the Medicaid space, just so there was an existing vehicle to move things through for their approval processes. And so we amended that waiver. We wanted to extend it because it was expiring. And so they're reviewing that. Most states have a waiver, many states have a waiver like this, and we don't anticipate any worries with this being renewed. What our federal partners have told us they're doing is taking bits and pieces of our requests and reviewing all of the states that ask for that thing at once, and then they'll issue guidance for us. So the first thing up is continuous coverage for kids 0 to 3 that we've heard is a priority for the outgoing administration to review all of those at once. And so there are a lot of states that have that waiver in. Colorado is one of them. That coverage would begin in 2026. So we're ahead of timeline as far as implementation, but yet, we don't, any delays on the federal side, of course, can impact getting the system changes, getting the training done, and getting the communications out. So we are hopeful we'll hear probably in the next, cross the fingers, week that this set of coverage expansions, if you will, or changes, 0 to 3 continuous coverage for 2 years, which was authorized by our state house 2 years ago, but to be implemented in 2026. We're hopeful, but we'll keep you all posted. And again, a 2026 implementation date. The other pieces that we have in the queue are that continuous coverage for folks leaving incarceration for a year. There are many states that have that same ask out, and we have that ask to our federal partners. We do anticipate this one won't come in the next few weeks. It might come in the first quarter of next year. So we're waiting to see what that timeline looks like. There are states, this was something that blue and red states, a lot of states were very interested in this policy. So we do anticipate this would move forward. It just might move forward a little slower if it doesn't get done with the current CMS leadership. Then we have some other items there that are related to the health-related social needs, that housing and nutrition supports. That's that bill that passed this year that expands Medicaid or allows Medicaid to pay for housing and nutrition. Really important waiver that we have. That is currently with our federal partners. That one we are hoping they will approve in the coming weeks. We are concerned that one might take quite a while or maybe not move forward, just depending on the new leadership. But that one is really important, and we are hoping we will have news here in the coming weeks. But I just wanted to let folks know we are going to, be in constant communication. We will let you know when we know, and we'll move forward together to serve our members. Anything you'd add to that, Kim? Okay.
Whatever I would add might change.
That's right.
It's for that reason that we didn't present a formal slide. I think we too are continuing to track and understand and interpret what we can. We do have a list of a few things that are in the hopper that we're hoping will make some movement, similar to
on the HCPF side. One of them, we're waiting a response on our TANF contingency fund. So we've already received a portion of those funds, but there may be still additional dollars coming. We anticipate, again, and I think that will be resolved before the administration comes in.
We're open.
Yeah. We also have a major change request out. Ms. Ghana talked about this earlier for our Gen AI for the SNAP program. That has been several months in process. So I am not hopeful that we would have an answer by the time a new administration comes in, but it is something on the list. We also have a pending waiver requested for oral explanation of work requirements waiver. So these, again, are things that we're working on with the Gov's office and trying to track what we can. And then last, I'm sure many of you know, we're still waiting for the Farm Bill to be signed and tracking that. We don't have any updates, but obviously something we're all looking to know or changes in the House and Senate occur, if that might be able to fix. So a lot of things pending. I think we're just kind of waiting to see, but also want you to know that we're tracking and proactively thinking about strategies to move them through as much as we can.
Questions?
I have questions going back to the previous ice, but I didn't want to wait till you got to the end to close and then be like, it's appropriate to go back.
This one?
Yes, yeah. What are we supposed to do with the messaging now that we have themes identified?
Yeah, I think we leveraged buckets, right, in our messaging for fact sheet for the budget request. I'm laying this out there. I talked earlier to the CCI folks down there because I know you all have processes to go through, but feel free to especially with those strengths of our model. I think we all are anticipating a tough session related to budget. So if there are pieces of that make sense for folks who are coming to testify or what have you, to use in your own words, feel free to do that. I was just wanting to make sure that it was packaged for you all so you could see what we did last session or our last session. So happy to repackage that in a different way if it makes it easier to share out.
Well, I guess, is it something that HCPF is planning to use too? Because I know a lot of conversations you all are in.
Yeah, we are using
that
those themes.
In what kind of places?
So in the 235 report, in some of the language there pulled from that, as well as, I mean, you probably heard Kim in some of her messaging, as well as when we get questions in advocate meetings and other places. So it's kind of more talking points and less of a written document, if that's helpful. And it might not be useful for you all, but I just wanted to report back since we did talk about it last time and make sure we acknowledge that there was a lot of work done, a lot of positive, movement, I thought, on the challenges because of the things that were included in the budget request and other solutions we're working on.
Thanks. I did not ask this question earlier when we were talking about budget because I wanted to give us all a break, but also under the challenges part of this messaging, the one related to the administrative inconsistencies, and I know I hear the recommendation 1 around phase 1 in the budget around business process standards. That I think that also is something we're just very nervous about and want to have more dialogue around because it was something we initially had concerns around the messaging, the way that the language was coming across. So I'm just teeing it up for a future conversation, maybe to talk more about, but not to go into depth.
That sounds great. And keep in mind, I transcribed from some of the stickies. So of course that could be refined here. So if there's some concern about the timing of administrative inconsistencies, happy to kind of refine that with you all.
I think that's probably a point of conversation for the task group or committee or whatever Director Binsteffer and Director Barnes said, for us to sort of kick off early next year when we get clarity on the budget moving through the process, and then we can start to talk about what even is a business process standard, I think is where we're starting from square one, right? 235 said there's lots of different processes and ways to do things. I think HCPF has data that substantiates that. CDHS has data that substantiates that. But we need to define that together. It will be from a HCPF or from a state perspective that we do want to see or drive towards more standardization. That is critical for us. But what that looks like on a day-to-day and what areas we focus on first and all of that, none of that's been decided. And I think is the important committee that we need to stand up to start to advance some of that work. And actually we're a little bit ahead because Rachel shot through her federal election update. Is there any other points on budget or anything else that we talked about that folks want to loop back around to? We're about 20 minutes ahead. Thank you, Rachel. Well, we were hoping Rachel would have a crystal ball that told us everything that would happen. All right. Anybody on the line? I see Deb in my little screen. Anybody have any other comments or questions on anything that was on the agenda today? Budgets, CHSDA strategic plan, which was more CHSDA structure briefing, which was still super helpful. CBMS or the county admin rules or the federal election update. Nothing.
Wow.
Well, then I think we can, Danielle's always happy to call a meeting early. Director Barnes and Director Binsteffer to wrap us up.
Yeah, thank you. I know we got a lot of action items out of today, but I also think it's more important the process that we're all talking about things. And one of the things I took away is that there are some places that we aren't getting together early enough and that we're getting better. Like, think of how far we've come, but we still have a ways to go on that. So you have my commitment. We'll focus on that. I also took a lot of the notes with the tech team about CBMS areas we need to work on, and you have our commitment on that as well. Budget, I'll leave that for Kim to discuss, because it's hard. I shouldn't have left for even 3 seconds. Yeah, I don't think I have anything else. Happen to take any questions any of you might have, but thank you for being here and taking the time. I know a lot of you drove in a long way to be here. And I think it's worth it. So thank you. For those on the phone, we did have homemade chocolate crepes, followed by pate. Deb's not fine. Deb's like, then the meetings. I said popcorn.
So thanks for making this important. Thanks for being here. Thanks for spending time with us. I had to run over to the State of Reform Conference and spend a little bit of time, and the stress is palatable of, the unknown can make people anxious and nervous. So my ask is, when that happens, call a friend, phone a friend, talk yourself down. We've got to keep our heads about us as this is it's just uncertain. And it's time to pull together. So that's what I'm saying. Thanks for these meetings. Thanks for spending time, and thanks for focusing on the right things for the budget, which is you right now. Where there's some tension, let's just get it on a list and talk through it. Just keep working through it. And thank you in advance for all the hard work. And thank you again for getting the work test done. And we got to put this PHE period. I never want to hear those 3 letters again. Close the door, new chapter, we're moving forward. Thank you. Appreciate everybody. Safe travels home.